Good morning. Good morning to everyone. I am so grateful that we had such an exciting and interactive sessions yesterday, and we have learned from you all about the important aspect of geriatric caregiving. And today, as we mentioned last afternoon, that we'll like to hear from all of you. We thought that initially let us try to recapitulate what we had. Hello, good morning, Professor Chetri. Good morning. Good morning. Uh, I think, um, uh, good morning, Dr. Mona. Uh,
Good morning, sir.
good morning,
Good
Madam
morning.
Professor Ruchika ji.
Good morning,
Uh,
sir. Good morning,
good
everyone.
morning, Patni ji. Good morning. Good morning.
Good morning, sir.
And,
Good morning, everyone.
Yeah. I think our team is so excited about the enthusiastic responses which we have received at the last task, which was entrusted, has generated excellent responses. I think Professor Ruchika ji is going to talk about that sometime later. I think we will first hear from our participants and try them to recapitulate what we did yesterday and what is there in their mind. So let us hear from, if those who would volunteer could write on the chat box and unmute themselves and mention. Okay. Yeah. Yeah. Hello. I think, can I request Kalpana Devi Gautam from the Nepali Society of Gerontology and Geriatrics? Or I think Ruchika ji will have to find out a way to get them respond.
Yeah, let me share a few words.
Sure.
My experience, if I may, Dr. Mathur and
Most
Professor
welcome,
Ruchika.
most welcome.
Sure, please. It will be nice to hear.
Yeah, it was, I mean, I heard the whole session. I was there looking at the interaction and everything. It's very good, but because the program is training of trainers, so we expect the people who are involved right now to be more have expertise more than the general caregiver population. So that's our expectation. But I think right now, many of our participants, they are looking to be, I think they are a bit of confused because, we are going so fast and there are a lot of questions and how it's going to be held. And, the practical things, how it's going to be linked up with when we are talking about online. So it's a lot of problem when there is no practical sessions, and if we are only going to watch videos. I think many of us are still, many of the participants are still wondering when we're going to mix the videos into this thing. So I think it's one of the confusion for many people right now going on. But I think if the participants are listening, it's going to be a whole different way when we really are going to train the caregivers, which is going to take a long time, so 6 weeks. So what I think is the trainers who are trained now should apply like Dr. Mathur was telling. So, you can modify this according to the situation you have. And then, for example, it's better if you have a clinical setting for many of the process that caregiving takes. For example, doing handling the people from wheelchair to beds, those kind of things. So maybe it's very difficult to learn just by talking. So those kind of experience should be learned, but maybe something where it's not possible. Video is better than nothing, but when it's practical, I think we need to have those kind of facilities if available. For example, someone who is training people in their local setting, it's the best they have at least some practical sessions combined. That way we will have the best caregivers, formal, informal, all kind of thing. So for now, it appears a bit of too much knowledge, for 2 days session, but I think it's a good start, and I'm really enjoying a lot. And thank you, Professor Ruchika and Madam, all the madams who have been engaging yesterday, Dr. Mathur for organizing this thing. I look forward to attend today's session. Thank you so much. That's all I have to say.
I think Professor Ruchika ji will tell us about the limitations of online learning. And definitely practical application is very important for this whole thing, because theory is just one part of it, but the important thing is the practical application. So Professor Ruchika ji will have some experience about that, and she'll mention about that.
Thank you. Thank you very much, Dr. Mathur. And thank you indeed, Dr. Jagdish. In spite of your busy schedule, you've been there throughout. It's really nice. And your observations are absolutely correct that people are getting confused. But what Dr. Mathur has, in fact, envisaged to do through this online meeting is basically sensitize all the experts to be the trainers. So whatever presentations are being made by the various experts are the tools that they will use for training. So maybe the participants may be getting a little confused, maybe feeling that the sessions are very heavy because they are going into the content. The purpose of this 2 days orientation, or practically 1 day orientation, is not to go into the content. They don't have to learn the content. They have to know how to teach that content to the caregivers. So they are being shown the content so that they know what they have to teach. So they have to, in fact, that is why this exercise was given, that the various topics, that how they will teach that content to the caregivers is something that has to be done. Of course, the online does have its own limitations. That's why all the presenters were giving the methodology in which the caregivers can do the training when they will be doing the mock trainings, like they can do role play through group focus group discussions, through demonstrations. So those are of course there, but I think when we will be discussing, some people have really very beautifully brought out the plan of action, and they have actually really, it is very wonderful. So I think that will be nice when we see that. Thank you, sir.
Yeah, I think this is one important thing, that right now it would just to give, uh, it is just an effort to give an overview of what is to be done, because we our participants are so experienced that the practical aspects they already know from their basic training of nursing or medical issue training, or being in the similar field for some time. But definitely practical training is an important part. But online, we will have some limitation. One thing which we are going to do is that all the participants would receive a set of uh, the presentations for the 6 weeks presentations which are we are already having, and a facilitator's book also, which will give them the details of each topic, so that homework they can do later on at their leisure time, because it is not possible to cover that whole thing in 2 days program. Practical training remains very important, and that has to be in the local context. We will have to define the way of doing it. It the the place where, and the person who would be receiving it, we will have to identify a local context for that particular thing. Okay, so that is one important thing, and it's an important thing which has been brought out by Professor Chetri, that the the caregiving is primarily a practical aspect. It is not theoretically nothing works in caregiving. It is all work and practical application. That is one important thing. Okay. We have got, we expect our other colleagues to come out with their feel, their observations or experience. Ice breaking is very important, isn't it? Yeah, hello. Yeah, hello.
So Priya has written that she would like to present her micro teaching. This is not the time for presenting micro teaching, Priya, but maybe you can give, your understanding of what you understood from yesterday's sessions as a master trainer. What do you feel that did it build up your capacity to become a trainer? How did it help you, the sessions yesterday? Maybe you can give a feedback on that. Yeah.
Okay, ma'am. Good morning, ma'am. Good morning, sir. Good morning, everyone. I asked this question, I think, yesterday, ma'am. So I was not clear about the micro teaching concept. So I thought you will be evaluating us on the behalf of that. So now I'm clear with it. So these last yesterday's classes that has been given by Dr. S.K. Mohan Sundari ma'am, she has explained it beautifully, and the topics were little fast. But as you said that these are not for the learning purpose, and we have to learn it when we are going to deliver it to the community or the people that targeted population when we are going to meet. So yes, it was a wonderful experience and hope to see it today again. And this is the TOT that will enrich every one of us with the full of knowledge, or at least the updated knowledge that we can implement in our day-to-day life also at home. Thank you so much, ma'am.
Thank you. I think so. We can ask Vin also to speak from Indonesia. Is she there? I saw her name.
Hello.
Yeah, hello.
Hello, hello.
Hello, everyone.
Yeah,
Good
hi.
morning. I'm Dr. Vina, an internist currently living in Qatar. I'm also part of the staff at Alzheimer Indonesia, Qatar Capture. I'm very happy to be part of this training. In my opinion, the training is well organized by the team with comprehensive and practical materials and highly professional speakers. Thank you very much for the opportunity to join this event. I hope the knowledge I gain here will be beneficial in advancing geriatric care in our respective workplace. Thank you.
Thank you. So can we ask Dr. Ken also? I think he's also from Indonesia and he has a lot of experience. Can you connect?
Yeah, I think he has to just or
His
they have to
name
just
is
unmute themselves. Yeah.
yes.
Ken is here.
He's there, but
okay.
okay. In the meantime, while he's trying to connect, anybody else?
With this particular time, we are just trying you to evaluate what we did yesterday, whether
Yeah.
it was useful or not useful, or the ways in which it can be improved, or what would be done to improvise it or make it better or so. So that is what it is I would say, evaluation of what we did yesterday, and we are trying to, because we need to modify or update that accordingly. So we
Maybe
have got
Sophia, we can ask Sophia, sir. Sophia too.
we have got yeah. I think please feel free to tell what you feel. That
Yeah, very good morning, sir. Myself,
yeah.
Priya, from nursing faculty from AIMS Mangalgiri. So yesterday we had the session that was very nice, wonderful session. Say especially the mainly the practical aspect, what to be emphasized for the caregivers, this informal caregivers. So we had a very good exposure of that practical aspects. We gain in-depth knowledge what we have to taught to that caregivers. Especially that Dr. Lata ma'am as well as Dr. Mona Sundari ma'am was given that expertise talk on it, starting from the communication till that how to mobilize. So what is that? Majorly they have covered about that. What are the aspects we have to cover to prevent that futuristic complications for the geriatric population? They are very vulnerable people. They are more prone to get that fall, pressure ulcer, a lot of problems. So they have focused on everything. So I'll show that. So whatever will be learned from here will be transferring to that to our caregivers. Thank you, sis.
So Sophia, I think she was online and she had come. Sophia, you can tell us how you felt more empowered after the yesterday's training. Did it help you to gain more skills?
Hello, good morning. Thank you for the opportunity for me to speak. And yeah, I'm so happy to join in this event because I learned a lot. Yeah, about the caregiving. Yeah, actually, usually as a doctor, I was asked by some friends to look for a caregiver for their parents. And then I just interview them and recruit them, But then actually, I don't know much about how to do it properly by myself. And by the way, the time going, then I think, most of them don't do their job properly. So I have to teach them. So yeah, with the lectures yesterday, so I learned a lot, and yeah, I'm so happy. And thank you very much for the practical hands-on lecture. Yeah, it's a good start for me. Thank you.
Thank you.
Thank you. Thank you very much. Now, I think we have a fully packed day today with a lot of material, technical material coming from for the geriatric caregiving. And to start with we finished with the 4 modules yesterday. And just to complete the symptom management and condition-specific care, I'll request Professor or Dr. S.K. Mohana Sundari to present this particular aspect to our participants, and then we'll discuss about that. Over to you, Dr. Mohana Sundari.
Yes, sir. Yes, I'm here.
Yeah. Please, you could share your screen, please.
Yes. Okay. Good morning, everyone. Sir, whether my slide is visible? Excuse me, my slide is visible?
Yes, yeah.
I want to ensure that the slide is moving or not. I'll just move and show the demo, sir. Is it moving, sir? Is it moving?
Yeah, it's moving now.
Oh, thank you, sir. Okay. Good morning, everyone. Again, welcome back to the Training of Trainers program on Geriatric Caregivers. And I am Mona Sundari, Assistant Professor, College of Nursing from AIIMS Bibinagar. And today I am going to discuss the topic on the week 3 courses is focusing on symptom management and condition specific care. And this is going to be a module 5, because already we discussed 4 modules. Week 1 course has 2 module, week 2 course has a 2 module. Now this is the week 3, a 5th module. This is focusing on a common symptoms, like topic 1 is covering a topic related to common symptoms like constipation, diarrhea, vomiting, nausea, and weight loss. This is mainly GI related symptoms. Topic 2 is covering about a cough and breathing problems as well as pain. Topic 3 is focusing on common problems like fever, itching, mouth ulcer, and dry mouth. And topic 4 is focusing on chronic conditions and especially diabetes, hypertension, stroke. So this is the most common chronic conditions. So we are focusing only these 3 parts. Now we'll start with the topic 1. Talking about constipation, diarrhea, vomiting, nausea, and weight loss. So we'll discuss one by one. The learning objectives of this particular topic is going to be that caregivers should recognize and manage common digestive symptoms in the elderly, and also prevent dehydration, malnutrition, and its complications, because we know dehydration is a complication of a diarrhea, and dehydration leads to an hypovolemic shock that is going to be life-threatening complication. So the caregivers should recognize those symptoms and prevent in the early stage. Now, regarding constipation, the topic which is covered under the module is the definition. The caregiver must know what you mean by constipation. You should know that it is an infrequent passing of the stool. It is not just a hard stool. The infrequent passing of a stool is called as in constipation. Not always the hard stool is considered as in constipation. And then you should know what is the causes for the constipation, so that you can prevent it in this beginning stage itself. Prevention is very important than treating. So once you know the causes, you can prevent it. So usually the dietary pattern of the elderly patients should be observed, because many elderly patients used to have their own food choices. They miss the fiber in the food, they miss the fruit, and they miss taking whole grains. So this aspect they should be conscious. And some medical conditions may be the contributing factor for a constipation that the caregiver must be aware, especially diabetes, hypothyroidism, Parkinson's disease. So the detail of this, how this condition is causing constipation, as a trainer you should explain them. And some medications like opioids, antacids, calcium channel blockers, and anticholinergics also having the side effects. It is not necessary to teach the full pharmacological effect of these drugs, but we should know these particular drugs are having the side effect of constipation. Then they should know what is the symptom of a constipation: hard stool and dry stool and abdominal pain and bloating and incomplete evacuation is the symptom. And home remedy prevention is the priority aspect, but still once the patient develops constipation, you should know how to treat also. You should know to examine the rectal area. Externally, you can palpate and you can see there is a fecal impact. And encouraging the elderly person for a mobility is the primary step in preventing the constipation, because lack of mobility is one of the reasons for developing this problem. And they can even use some herbal and natural remedies like using the vegetable oils, but we should tell them the importance of using the vegetable oils and quantity, how exactly and when it should be given, how it is helping in lubricating the digestive system. And water bath, warm water bath, and putting oil in the water and then making them to have a sitz bath. These are all the home remedies. They can have some other home remedy, but whatever they know already, the previous knowledge should be cross-checked by the trainer, and you should see that whether those practices are healthy practices or not. Then we can recommend that. And when to seek the medical help, they should be very aware about it. So when the person is experiencing more pain while passing the stool and feeling very difficulty to pass the stool, then that is the point to seek the medical help, and that time home remedy should not be continued. So caregiver must be aware. And you should know to follow some preventive strategies also. This knowledge should be transferred to them. And this is a very common point that we all know. But one important point to emphasize from this area is laxatives and stool softener administration by the caregiver should be from the approval of the doctor. They cannot do by themselves. And other remedies like increasing a fiber intake, increasing fluid intake, and encouraging to do daily activities, exercises, and giving importance to the word of elderly when he says, "I am urgent to pass the stool," without delaying, taking him to the washroom or providing bedpan. It's all is the responsibility that he can do independently. But when he is giving the laxatives and stool softness, you should consult with the physician. And it is very important to establish a routine for the elderly. in the defecation process. So daily, same time, you have to take the elderly to the washroom. So you have to spend some time there. Then routine will be established. So constipation can be relieved with establishing routine. So what you have to teach on diarrhea, the frequent passing of are unfounded definition. They must know what is the definition of a diarrhea. Sometimes the normal stool, which is a loose, also the people will consider it is a diarrhea. It should not be misinterpreted. So the difference should be told to them clearly. And they should aware which food is causing the constipation, what medications are making diarrhea, and what disease condition is making them to develop diarrhea. And improper food hygiene also is one of the cause for diarrhea. They must have to maintain the hygienic practices in preparing the food. So why they should know the causes of this? Once they're reporting to the doctor, they should be able to say what medication currently the patient is having, what type of food he had yesterday and before yesterday. That knowledge you have to transfer, you have to tell to the healthcare worker. That's why you should know all this. Then you should know the consequences of prolonged diarrhea. I said already, diarrhea leads to dehydration, and dehydration, when we are allowing it for a long day, then you will develop hypovolemic shock, which is a life-threatening condition. So preventing is very important. So you should know the consequence of diarrhea to treat it immediately. And how you can manage is, you should know that immediately after, once the person is experiencing diarrhea, you have to give additional fluid in any form, however he likes it. And you should know how to prepare the ORS, how to use it, and how long the duration. The instruction of using the ORS should be clearly informed to the caregiver. And dietary management. As the diarrhea is there, many people are having a wrong belief that we no need to give anything to them because he is passing stool as we are giving something. It is not like that. That is the time they have to eat more, because the energy is lost. Nutrition, you have to maintain and balance it by continuing the feeding. We should not stop giving the feeding, but we can alter the nature of the diet by bland diet can be given. So that is the thing acceptable, rather than stopping the entire feed. And then frequent, when the person have diarrhea for a long duration, the caregiver should give attention to the rectal area also, because the hygiene of the rectum is important. Rash may develop, they may have a pain, and the skin can get damaged. Once it get damaged, and again they will have more pain when passing the stool. That will become one cause for developing the constipation after the diarrhea episode is over. So skin care, rectal care should be given more importance. And when they have to meet the medical persons is when he feels some warning signs, like when the diarrhea is associated with the vomiting with fever, or there is a blood in the stool, or the diarrhea is prolonged, or the condition is worsening, the person is becoming weak day by day and weight loss is happening. It's a time to go to hospital than waiting at home. And vomiting and nausea is that there is many reasons the person, even stress can cause nausea and vomiting for elderly people. And then bad odors and smells and some irritants can cause nausea and vomiting. So it is not important to know what is the cause for the vomiting and nausea, but you should know how to manage when the person is experiencing it. So that time you can give that food which is mostly preferred by the patients, and you can recommend the food which is reducing the incidence of a nausea and vomiting. Some sour pickles and those things can be given, and you can offer more fluid, because vomiting will cause dehydration. So that time you have to give more fluid to the persons and remind him to take fluid very often. And some local remedies also can be followed, like people used to lick the ash which is coming from the wood. No? That is also okay, but you should collect the knowledge of a caregiver, what home remedy you used to follow, what knowledge you have, ensure that those home remedies are safe to the elderly. And then environmental considerations, that you should avoid the strong odors which is going to be the irritant which is causing a nausea and vomiting sensation. When the vomiting is prolonged for a long durations, and when this person is experiencing the signs of dehydration and having abdominal pain associated with the vomiting, there is a serious thing to evaluate. He need to go for a further evaluation. So home remedy may not be suitable that situation. Then weight loss. When the person is experiencing weight loss, then you should encourage him to eat more food, and gentle encouragement is done instead of roughly dealing the elderly. Just tell them you have, without forcing them, you encourage the person to eat, and you can plan the menu in such a way that he will feel to eat small and frequent menu 5 to 6 times, and in between healthy snacks, and that can be given. According to his wish, you can prepare the food so you will feel to have food. So that is the way weight loss can be managed, and frequent monitoring of the weight is important. Then when to seek a help, when there is a rapid weight loss, or a person is continuously refusing to eat, or he have a difficulty in swallowing, that is the reason for a weight loss, but he has interested to eat but difficulty in swallowing, then that person need to be further evaluated by the healthcare person. So that time the caregiver should take the elderly to the hospital. Now, practical area of this topic is you should demonstrate how to prepare the ORS and how to use it. And you have can usually in India nowadays, all the homes we are using the Western toilet rather than Indian toilet, and squatting position is the one which will prevent constipation. But old age people, due to joint pain, they may not able to sit in the Indian toilet. So we can provide alternative in the Western toilet itself by providing a footstools, and that will be there so that they can keep the head elevated, so flexion of the hip joint can happen, so the movement will be bit free. So this alternative technique we can show to them, and encourage safe hydration strategies for the patients, because diarrhea need and vomiting, this area need to be focused. That hydration, what is the practical aspect here is teaching them amount of fluid and how it should be given in a one day. That aspect you can demonstrate. Now, what is the emphasis that you should give for the caregiver? Your caregiver should early recognize the symptom of an diarrhea, dehydration, and able to encourage the mobility, which is going to prevent constipation, and maintain privacy during the defecation process, because lack of privacy is one of the reason for developing constipation. If the person is a bedridden and you are going and providing the bedpan and standing there itself, he may feel uncomfortable, so he will control his bowel movement. So if you provided the bedpan, you can just move away, and if you are keeping taking them to the washrooms, then you can just stay away, and you can ensure the safety, but you can stay away, so you will have some privacy. This is the thing that you should ensure to the person. And monitor hydration, weight, and appetite of the person regularly, because it is related to an, weight loss and diarrhea. No, monitoring is very important. And training approach, how you can teach this topic, it can be through this case discussion method and practical method. Then ORS need a practical aspects of demonstration aspect. A case discussion, you can discuss the experience of elderly person with constipation and poor appetite, how it was dealt, how it can be dealt. The take home message of this topic is early recognition and simple home management alone is enough to solve most of the GI related problems. And so that we can prevent dehydrations, malnutrition, and serious health risks in older adults. So, how to recognize the things in the early stage is the important information that caregiver should receive from us from this topic. Then the topic 2 is about cough and breathing problems and pain. Old age people may suffer from some respiratory issues, some due to poor immunity. Many health issues may develop, and that may make them to develop and breathing related problems. So it is a most common problem only. And what is the learning objectives? Identify and manage the cough, breathing problems, and common pains in the elderly patients. So in cough and breathing problems, what we need to emphasize to caregiver is they should know the different types of cough. Why? Because when the chronic cough is there, that could be due to a TB or any asthma, some chronic conditions that need to be evaluated. It should not be ignored. And acute cough will be for only 3 weeks. And when the subacute cough is 3 to 8 weeks. When cough is there more than 8 weeks, the caregiver should take the elderly to the hospital for further evaluation rather than just considering it will settle down by its own. And you can do a simple remedies until that stage is acute cough stage. You can follow this remedy. Once it is becoming chronic, you cannot follow the same home remedy. You have to take to the hospital. So there are so many home remedies, which is I given some examples here. The caregiver may be knowing some other examples also. We are dealing with the cough also. Collect that information from them and ensure that is safe for the old age person. Then when to seek the medical help is when the difficulty in breathing is keep on increasing, the person is having chest pain along with breathing difficulties, and cough lasts more than 2 weeks, and blood is coming from the sputum, then that could be lung cancer or anything, need to be evaluated, should not be ignored. If the person is dealing with a TB patient, and he should be taught about how to handle the sputum, how you have to collect with that, how to neutralize it, how to dispose it, those information need to be passed. How he can protect himself and others from the TB should be taught to them. And muscles and joint pain. Cause for the joint pain of elderly is lack of mobility, joint stiffness, less movement only. Most of the time, this is the reason. They develop a frozen shoulder also because they are not moving the extremities adequately. So what management strategies we need is, first, promote activity. Caregiver always ensure that activities today part of their daily life, they do some activities to keep their body movements happening. And if the person have any joint pain, arthritis conditions, assist him for the movement, and do a massage wherever the muscle pain is there. You can do a regular massages and gentle joint exercise of any knee joint, hip joint, shoulder joints, and elbow joints. If are doing, then that joint stiffness may not develop. It is very important for the caregiver to encourage the elderly to participate in own exercises and activities, rather than we do passively for the person. We should not do everything. We should encourage the elderly to come out with some activities. When person is not able to perform any exercise, it is the high time to take a medical help rather than trying these kind of management strategies at home for the joint pain and headache and other pains. And then the definition of a pain is again important thing the caregiver should know. Pain is what the person says, not what you just feel it. No, what the person says. If he says pain, definitely maybe having the pain. You don't judge that by saying no, you are comfortable only. Why are you saying pain? No, it's a personal experience, subjective feeling. So pain definition is what the person says about his comfort level. So once you person says that you have a pain, then immediately you should think of some. First, you have to think of a non-medical interventions. Then you should think of the medical interventions. So non-medical interventions for pain management, again, many interventions everyone knows, caregivers knows. We also as a trainer knows, other than what is mentioned in this slide. Ensure that caregiver, whatever non-medical interventions he is having, is not a complicated thing, and it is safe for the elderly. And we should tell them what painkiller should be given, and the painkiller should be given with the consultation only, not without a doctor's prescription. He cannot take his own choice of giving the painkiller. And then you have to monitor how this pain is responding, and then monitor that what is the dose time of painkiller is given, how frequency it is given. It should match with the prescription of the doctor. Then additional comfort measures can be followed by the persons, and you should avoid aggravating factors which is increasing the pain. And gentle movement can be done, but excess movement of the joints will increase the pain. Then when the pain is persistent and recurrent, it's a time to take a medical help. This steam inhalation for a cough is home remedy that with menthol or eucalyptus, you can show a demonstration of how to do steam inhalation, because some principal steps are there. How to inhale, how to exhale, how long to keep this vapor inside, all those things should be demonstrated. And we can teach the chest percussions and vibrations as a part of chest physiotherapy to clear the mucus, if presence of mucus is the reason for a cough. So that can be demonstrated, and you can demonstrate the joint exercises to prevent muscle and joint pain. The training emphasizes encourage movement to prevent stiffness, because the reason for a muscle and joint pain. Recognize when to take the medical help. So you tell the persons clearly which is the warning sign that required a medical attention rather than a home remedies. A training approach could be, it can be a role play when the person is coughing or when the person is having breathing problems, how you are going to support him, that you can show as a role play. And you can chest percussions demonstration can be done. And take home message, timely recognition and simple care for cough, breathlessness and pain can prevent complications and improve comfort level of a patient. The third topic, fever, itching, mouth ulcer and dry mouth. Learning objectives are manage the fever, itching, mouth ulcer, and dry mouth in older adults. Know when to seek the medical help. And then fever, definition of a fever, they should know that a fever and warmness of body due to weather changes are not safe. When they have hot weather, their body may feel warm. It doesn't mean that the person is having fever. You should check objectively body temperature with the thermometer and confirm it is a fever. Once he realized that the temperature is more than 98.6 degree Fahrenheit, then immediately he can take a home remedies like increasing the fluid intake, giving them the light food, providing adequate rest, temperature regulation at the room, and providing antibiotics as per the prescriptions. That can be done. But fever also should not be ignored by giving the home remedy itself. When the fever is reaching 103 degree Fahrenheit, or when the person is having some rashes or some abnormal sensitivity to the bright light, the snake stiffness is there, or when he is having pain and bending the head forward, or mental confusions and persistent vomiting, these are all sign of a systemic infection. So that should not be ignored. And a convulsion, seizure, all those is a sign of a brain infection, meningitis, it could be encephalitis, and breathing issues, it could be pneumonia. So it can be a sign of a systemic infection. That time a simple home remedy is not helpful. You have to take the persons to the hospital. When dealing with the itching, you should know what is the cause for itching, whether any diet is the reason, or dry skin is the reason, or dehydration is the reason. Identify the cause and prevent that cause. And manage itching by cooling the skin, by applying some Vaselines or any creams, and some special bath also can be planned. And avoid further irritation by avoiding scratching. Usually people feel more comfortable in scratching and they make more, and then they will damage the skin. So better to cut the nail and maintain high hand hygiene, nail care, so the scratching can be avoided, and keep supervise that the nails are short only. And moisturizers can be used. A natural remedy, cucumber can be cut and applied over the skin, so it will cool the skin. And tea bag also we can apply over the skin, so it will cool the skin. And we can even put oil over the bathing water, so that will moisturize the skin, so dryness can be avoided. So when the itching is persist and the complication is developing like a painful blisters, and the itching infection, skin infection is spreading all over the skin, then it is a time to take a medical help. And mouth ulcer or pain on swallowing, identify the cause for mouth ulcer and what is the reason for a pain. And you can go for a home remedy by adjusting the diet according. When the mouth ulcer is there, better to give the liquid food, which and when swallowing difficulty is there, soft food can be given. And spicy food should not be given because it will cause more burning sensation of the oral cavity. And regular oral hygiene is important. Remove the food debris, and because that can cause a bad odor, and it will be one of the reason for an infection of mouth. And rinse the mouth with the salt water or baking powder rinse. You have to demonstrate how to prepare the salt water for the rinse. And for the pain relief, we can advise them to take aspirin or mouth rinse. And this aspirin again with the medical prescription only, it should be advised to them. And general comfort measures like use of a soft toothbrush. We know that now ultra soft brush is available. That is the best brush advised to the old age people, so it cannot damage the gums and all. And avoid strong odors. Then when the symptom persists, it's the time to take a medical help. Then we can demonstrate this tepid sponge bath and cold compress for managing the fever. And we can demonstrate how to show how to prepare the salt water for mouth rinse. And also you can guide them how to apply the moisturizers for the itchy skin. So this is the practical area of the topic. What we have to emphasize is ensure that proper hydration and oral care to prevent mouth ulcers, and avoid aggravating foods or orders, which is increasing the which is further making worsening the conditions. And monitor the severity. And why to monitor the severity? That time only they know when to refer the patient. The training approach could be demonstration and question and answer session. We can just make some questions and they can come out with the answers, because many things are here related to an home remedy only. So you can take more information from them and evaluate what they say is up to the mark. For take home message, prompt hydration, oral care, and comfort measures reduces distress and prevent complication in elderly with fever, itching, and oral symptoms. The last topic of today, of my presentation, is care for chronic conditions, especially diabetes, hypertension, and stroke. Learning objectives, support home management of diabetes, hypertension, and stroke, and they should be able to recognize warning signs which require urgent care. For when a caregiver is dealing with the diabetic patients, you should know when to monitor the glucose, how to monitor, how to use the glucometer, and what is the normal glucose range for that age group, what is the random blood glucose range, postprandial, everything they must be aware. And they should know the importance of giving and the medications on time, and importance of giving a structured diet, balanced diet for a diabetic patients in maintaining the normal blood glucose level, and value of exercise in controlling the blood glucose level. And also they should know the sign of an hypoglycemia and hyperglycemia, because that is that once they know the sign only, they will immediately take a next remedy for that, whether taking to the hospital or giving an medication immediately, insulin immediately. So, or in case of hypoglycemia, they should know that immediately they have to give some chocolate or a sugar to the person to bring back to the normal. Not only hyperglycemia kills the person, hypoglycemia also kills the person. So they should aware about it. And food care, again, very important. Every day the food examination is done, and advise the elderly that you should wear the food which is more comfortable and soft, which is not damaging the food, and every day should be inspected by the caregiver. And the hypertension patients, again, monitoring BP is important, and they should know how to use the digital as well as the manual BP apparatus. Usually manual BP apparatus shows more a typical BP than the digital one. So they should able to use both the things, and they should give the medications on time and right dose to the person, and very periodically they should take a review from the doctor. So you have to take the elderly to the hospital periodically to review the medicines which is taking for the BP. And low salt diet should be provided, and exercise is important in controlling the BP. Weight management is again very important interventions. And stress management, caregivers should keep the elderly happy always and stress free always. You have to advise the elderly not to take any alcohol or smoking, because that is aggravating factor for an hypertension. And monitor the sign of a hypertension crisis once, because hypertension crisis is a life threatening condition, no, that required immediate attention. Once the BP is crossing the limit, when it is nearly 160 170, it is the time to take hospital. And otherwise waiting till it is reaching to 180 is not fair idea, because 180 is the condition called hypertensive crisis. So once it is crossing 150 only, you should be alert and have to take the person to hospital to adjust the medication. A stroke patient, they require a rehabilitation. Caregiver should learn how to do physiotherapy, which is suitable for their alerted patient, and he should also get trained in speech therapy, or he can take the caregiver to those areas frequently to get adequate physio and speech therapy on time, and assist the persons for activities of daily living. Ensure that the person is not fall, and ensure that the environment is safe for him. Make sure the person is having safe mobility, and prevent bed sore, because stroke patients, based on the severity, they may become bedridden also. So bed sore should be prevented with continuous observations, and frequent shifting of position should be done. So details are given in the model. And emotional support. So far the person is independent, and because of stroke he become dependent. How much he will be emotionally weak? Understanding that emotional pain is very important, and addressing the emotional need is again an important thing. And monitor sign of a complications for a stroke patients. What is the complication? They must have aspiration during feeding is main complication. Other than there are so many complications, they must aware of all this. Then practical part of this topic, they should know to check the BP and know to monitor the glucose at home, and they should know how to give a food care for a patient, and how to do a safe transfer technique for a stroke patient, and safe feeding technique also for the stroke patient. The training emphasis will be reinforce the medication adherence, how much it is important in maintaining the glucose as well as BP, because the BP hypertension crisis is the reason for developing stroke. It's a complication of an hypertension. Now, support lifestyle modification for a person with a chronic condition, especially for a stroke client, and recognize red flag symptoms, that is a warning symptoms, that sudden weakness and chest pain and confusion is considered as a very warning sign. That time the person should be taken to the hospital. Training approach, you can demonstrate those glucose monitoring and BP measurements, and we can also have a case-based discussion. Take home message: consistent monitoring, adherence to treatment, lifestyle support, and caregivers encouragement improves outcome in chronic conditions. So the chronic patients required not only the caregiver get frustrated with, even the care recipient also is frustrated, becoming a dependent, and caregivers will get more frustrated doing a routine care to the dependent patients. So they also require encouragement, then only they can do the routine things, they can justify their role. So encouragement to the caregiver and consistent monitoring of their care recipient is very important to have a better outcome in a chronic condition persons. So that's all about my topic. Thank you so much for patient listening. Now we
Thank
can
you.
have.
Yeah, we can have some questions because this is a very important subject. And we expect questions or observations from our colleagues and participants. Because managing these chronic conditions is very important. These things are diabetes, high blood pressure. They are the commonest non-communicable diseases which occur in the older people, and almost 1/3 of all older people would have either of them. So I think knowing about this is important, and teaching about this to caregiver is also important.
Sir, good morning. Am I audible?
Yeah, please.
Okay, so very good morning, sir. I am Rimi Chakravarti. Actually, sir, I am in Hills, so I have some issue in my camera. So I want to share because it's a very important topic, as you said, and Madam has also emphasis on that. It's a very fantastic presentation. It's a very well structured presentation, rather, I can say. And actually, I made my plan of action in this topic. So I am very much interested in this topic. So it's a very excellent effort, ma'am. Thank you so much to sharing all the information. But I just add one thing that is very important, that yesterday madam has given us emphasis about the adult learning approach. So it's very important. So if you could have add some more the practical oriented thing, or you can share your experience in the giving care or the managing emergency, so I think it will be more impactful on that aspect. That is the thing I just wanted to share.
Yeah, I think that's a good suggestion. Dr. Mona would respond to that.
Yes, can I get the question? I'm not understanding your question. Can I please have your question again?
Actually, I don't have any question. I'm just trying to say that it's a very well structured, prepared, all the emergencies. Because I told that I have also prepared, because I am an international trainer and I have a lot of experience in managing the geriatric patient. So I have a lot of stories regarding these aspects. So I just wanted to tell that sometimes you have to give some practical experience, so that can create a more impact, right? So that is very helpful. Like, we know the knowledge because it's all the theoretical aspects. So we know the knowledge, and we all are in a master class. So in master class sometimes it's very, you need to do the more effective. So the empathy, the communication, the how the caregiver communicate, because nail care we know, the bed bath we know, because we have the checklist, all the nursing aspect, all the medical aspect. But thing is that how you can do this, or sometimes the patients or the family member are very intellectual, and they are sometimes they are in abroad, they are saying why you are putting this care, why you are giving this care. So this aspect is very much needed. So the soft skill is very much important in that aspect, right?
Yes.
Okay.
But I have one solution for this. When we are empowering the caregiver with enough knowledge, when they can tell the rationale for why they are doing it, then definitely the family members will get convinced. That our aim is to empower them. So this is the anyone informal caregivers, the family members are doing, and nobody is going to question them what they do for their own family members. When somebody do it for their family, definitely the question will come. That is the reason we have this formal course and training them with adequate knowledge. We have just highlighted what to be taught, how to be taught, what information to be taught in detail is there in the module. That concept should reach, and we should ensure that this information is reaching to them, ensure that they reassess them, that they know everything. Then we'll be certifying them they are the caregiver. Definitely then they can justify to the patient, and family members may not raise the question. They should answer to the family members. Definitely we make them knowledgeable.
Yeah, definitely. That's why it's a more important. That's why I said that it's a very much informative. But you have to make it more impactful, and that is the essence. Because
Yes.
teaching is something and training is something. I believe that.
And we have
After
practical
my
aspects.
experience.
Each module we are having a videos of whatever we are teaching here as in key content area. We have video for everything. We are preparing the video. We are on the way. Everything we want to show as a video, and we want them to redemonstrate. We ensure their skill is done, because theoretically we are telling them not enough. Now case-based discussion and role play and video presentations, and then redemonstration, these only going to help them. Only teaching theoretically, definitely nobody will be interested. No, and that too they are 10th and 12th past people who is going to be participant as a trained caregiver. Definitely they need some better approach for teaching.
Thank you. Thank you so much. Thank you.
Thank you.
Thank you sharing for a lot of things. Thank you.
Thank you.
Thank you very much, Dr. Mahana Sundari. I think, can we move to the next topic? And it is about emergency care and medical equipment use. And we have Manulata to present along with Dr. Mohana. So over to over to you for the second session. Please.
Good morning to everyone. And first of all, I would like to thank all the organizing team members for giving me opportunity to take session on this topic. So without wasting time, we will start with our topic. So ma'am is going to share my slides. So after that, we'll start.
Sir, is it visible?
Yes. Yeah, it is visible now. Manulata, you could start. Yeah.
Yeah. Thank you, ma'am. So welcome. First of all, I would like to welcome you all to our training of trainer programs on geriatric caregiver. So this is Manlata, currently working as a nursing officer in AIMS Bibinagar. So the topic which is assigned here to me is on emergency care and medical equipment use. So in that we are going to discuss the 4 topics. First of all, managing emergency. In second topic, we will see managing medical equipment like hearing aids, BP apparatus, glucometer and nebulizer. And the 4th topic, that is household medical waste disposal. So in this module, we are going to cover these 4 topics. So first of all, we will see managing emergencies. So this emergency, it will come without warning. So sometimes, we as a caregiver, we have to be very well aware, we have adequate knowledge, how to take care of patients, in a home setting or in a hospital setting, wherever these caregivers are, they have to be very well aware with and the condition which can occur anytime and it will be like a emergency, and it will come without warning. So that time they have to be aware how to take care of all those things. Okay, so our objectives here is we have to recognize and we should know how to manage emergencies in older adults. So these all topics we are going to cover. That is, first is loss of consciousness, convulsion, shock, chest pain, confusion, falls, and breathlessness. So all these topics we are going to cover one by one. And one important thing, like as a caregiver, like how like they have to be first see their safety, like where they are actually, and how they have to take care of their patients, geriatric patients, and like if any emergency will occur, that time how calmly they have to respond, like how they have to assess and what they have to do, that thing like we have to see. So here, like the emergency principle to manage any kind of emergency, first for the caregiver, here I'm going to tell, like first they have to stay calm. They have to assess like what they have to do and what they are going to do actually. Okay, and like after assessing all those things, like they have to act accordingly, like based on the emergency, like what they can do for their patient, like that thing they can do. So they have to act accordingly. And next, documentation. So like whatever they did with patients, so they have to document. They have to document everything, like in which environment, in which setup, like that thing happened. So they have to document, and that documentation is very important here, because this thing only they are going, once they will reach hospital, this thing only they are going to tell to their healthcare worker or their prescribing doctor. Okay, so the principle here, for especially for the caregiver, is like they have to be stay calm, they have to assess, and they have to act accordingly, and everything they have to document to tell everything in front of doctor when it is needed. Okay, so let's start with our first emergency, like loss of consciousness. So whatever emergency here we are going to see, some points, like some emergency will be like in adults also we can see anytime, and like mainly here our focus is on geriatric patient. So when there is a loss of consciousness, so this loss of consciousness, what is the reason? Like because of lack of blood supply to the brain. Okay, so that is because of any condition, like if there is any trauma, or is there any severe bleeding, or if the patient is having stroke, history of stroke, so that patients are again in the so if all these condition, if any of these condition is present, the patients are more prone to lose their consciousness. So in that condition, what they have to do? So first, as a caregiver, they have to assess, like first they have to be calm, and they have to assess like what they have to do with that loss of consciousness thing. So they can go, they just check for the responsiveness of the patient, like whether patient is responding or not. They can give any painful stimuli to the patient, and they can just check like patient is responding or not. If they, and if still the patient is not responding, they can check the breathing and pulse, and if it is not there, like directly they can start the CPR. Okay, so like in that way, like if there's a loss of consciousness, like sequence wise, what all things you have to do as a caregiver and as a trainer, what all things we have to teach to the caregiver to manage this loss of consciousness condition as an emergency. Okay, so after, like during, like they have to take they have to give CPR, and they can take help if anybody is there, or they can just call to the ambulance, or to take care their patient to the hospital. Okay, so next condition here is convulsion. So convulsion, like it is an epileptic seizure, and like again it is a kind of emergency only. So in that convulsion, what we can do, if any we are seeing any in hospital setting also, like I had seen when I was in neurology department, I had seen like patient immediately. That patient got to see that patient is sitting on wheelchair, and that patient got seizure there itself, and suddenly that patient, because of this in convulsion, there will be the involuntary muscle contraction. Okay. And the patient, sometimes patient violent or irregular body movements will be there. So patient lost their this control on their body, and patient fell down from wheelchair. So immediately we ran to that patient, and like we had lied on that patient on the floor, and like we turned the patient's head, because full drooling from the mouth was present. We just turned the patient head on one side. And like if this condition is occur in the home setting, like there, like you can provide some pillow, so that you can prevent any kind of injury that can occur on head area. Okay, and like during seizure time, like we should not restrict any kind of movement to the in the patient. Okay, because again it will cause any kind of fracture to them. Okay, and whatever the tight clothing is there, so we loosen that old age person was there, so like drooling was there, so we just turned the patient's head on one side, and like the clothing, so that thing we just loosen up, and we just kept that patient for a time being there only, and like after that the recovery portion given to that person. So in like conversion, like if you are having that adequate knowledge, like if conversion is there, how they have to manage that thing to the caregiver, that is very like as a trainer, to the caregiver we have to tell all those things. If they are having knowledge, then only they can handle these things, because like without knowledge, like here what I saw, when the patient that patient got seizure, immediately the family members, they are giving some iron or key metallic thing in the, trying to give that metallic thing in the patient hand. I don't know why that thing they are following, maybe some myth, that is key, if they will provide some metallic item in the patient's hand, it will help to recover that from the fits or seizure. So like that practices are there, so we have to take care of all those things. And again, if they will provide any metallic item or sharp items in their hands, again it will harm to the patient, because they are not in their control, because full involuntary muscular movement is there. So again it will harm to the patient. Okay, so like this, if conversion is there, so these things, as a caregiver we have to teach to the caregiver, so that this thing they can manage. Okay, anywhere, if it is in like if it is there in home, or it is there in hospital setting, they are able to manage by themselves. So like place on the side with pillow under the head and loosening the clothing, try to avoid giving any kind of restraint, and like note the episode. Noting the episode is very important here, because like how long the duration we have to like we have to write down, because the duration and the type of seizure patient got, and the type of body movement it is, whether it is tonic or it is clonic, and like mm, or if is there any movement in the eyes, or in particular direction, that thing, everything we need to note down. Okay, so this is about the conversion. So the next condition which we are going to see, like shock. So shock because of low blood pressure. So this shock can that is also because of if like causes, like if there's a trauma or any severe bleeding, the blood pressure will go down. So because of hypovolemia, shock, so that thing will occur. So like as a caregiver, first you have to assess like how you will distinguish, like whether it is a loss of consciousness or what it is. So some common sign and symptoms will be there, that you have to find out, and after that only you can take care of your patients. Okay, so like if it is a shock, that time first of all you have to see, like you can check the extremities will be cold, and the rapid pulse will be there, and rapid breathing will be there, breathing will be there. So this thing, as a like caregiver also can check, but if any healthcare professional, like if it is possible, they can check for pupillary dilatation and all. The patient will feel nausea and vomiting, so these all symptoms will be there if the patient is having shock. So this thing we can check, and like after assessing all the sign and symptom, we have to lie down the patient on the floor, and like what intervention they can do, they just elevate the leg end of the patient, and with that there will be the good blood supply to their vital organs or to the brain, and so after that at least we can preserve their vital organ. At least if the brain is getting a good supply of blood, the consciousness, at least that thing will be there. And other thing, like cold and clammy skin will be there, so we can provide some blanket to keep the patient warm. And if it is needed, if still the condition can worsen, is worsening, we can take anybody's help. And during while doing this giving position and keeping the person warm, that time also you have to monitor the patient frequently for breathing and for the pulse, because maybe the condition worsen also even after doing this. So like we have to see all those things, and we have to keep on eyes on breathing and pulse, because maybe the patient will collapse after that also. So we have to monitor that thing in between, and if needed, CPR also we have to give in that condition. So this is all about shock. Like as a caregiver, as a trainer, what all things we have to tell to our caregiver to take care of their patients. So next condition here is heart attack. So heart attack nowadays, it is very common. We can like this cardiological issues are very common. We can see anywhere nowadays. So many cases are also coming. Okay, so if our patient is prone for heart attack, so like as a caregiver, like you should know the sign and symptoms, like what kind of sign and symptoms it will be. Like chest pain will be there, patient like breathlessness will be there, the patient will complain like some radiating pain. Okay, so with this sign and symptom, you can suspect like maybe the heart attack is maybe chances is there. Okay, so like in a home settings, as a caregiver, you are very well familiar with the medication the patients are using. So if the nitroglycerin medication is, if it is already prescribed by the doctor, so by that time, during that time, this medication can be given sublingually or by the orally, and after that patient will be somewhat okay, and by that time we can shift the patient to the hospital setting. Okay, and during while shifting also, while transferring a patient to the hospital setting, that time also we have to closely monitor our patients, because maybe the again this attack will come or something. So that time this nitroglycerin again maybe means again after 5 minutes also we can give like sublingually, maximum 3 doses we can give. So if we the caregiver is having that knowledge, the caregiver means they can take care of their patient very well, and by that time they can reach hospital also. Okay, and in heart attack also, like some of the some of the things, like before itself, like if our patient is prone for getting heart attack, some of the things like before itself we can take care, like some modifiable risk factors are there, and like this risk factors before itself, if our patient is prone to get heart attack, like that risk factor we can modify, like if the patient is doing smoking, taking alcohol, and high cholesterol diet is there, and like sedentary lifestyle is there, so these are also modifiable risk factor. And if there is obesity, so this thing can be modified before itself, we cannot like somewhat we can able to prevent this chances of getting heart attack to our patient by modifying all those risk factors. Okay, so as a caregiver, you should know, like caregiver should know like how to manage all these condition. Okay, so the next condition here is confusion. So confusion, like our geriatric patients are so much prone, like they means because they are using so many medications, diabetic medication or hypertension medication, thyroid medication. Because of using all those medications, sometimes these patients are because of side effects of these medication, they are getting confusion and all. Okay, so again in old age, because of shrinking of brain, and it will be there, so confusion, this thing will come, okay, by age. So that time how we can take care of our patient, like we can maintain the familiar environment for them, like wherever they are staying, that an environment should be very well familiar to them, like or like whatever things we used to keep on a particular place, that place only we have to keep, so that our and try to avoid frequent changing the thing from here to there, so that they will not be like confused, like and like somewhat we are trying to maintain their environment familiar to them, and like they will not get any kind of irritability in that environment. Okay, so try to maintain the familiar environment. If any, again, need to reduce noise, if any excessive noise is there, so that thing need to control or reduce, because continuous, it is a kind of stimulus which is going to affect our patients, so that thing we need to reduce. So that we can provide some friendly or comfortable environment to our geriatric patients. Okay, and wherever it is necessary, like we have to supervise, sometimes the condition will come, like they need some assistance, they need some supervision, that time we have to assist them in doing particular kind of thing or particular kind of work. Okay, so we have to supervise so that they won't be irritated. Okay, so and like as a confusion in some if it is worsening, that time what will happen, the forgetfulness will be there, the irritability, mood irritability will be there. Okay, so and the sometimes patient will be like out of control, means they will go naked. Okay, and like they will be abusive sometimes. So in that case, it is good to take doctor's prescription to handle all those conditions. So this is all confusion. So next condition here which we are going to see is falls. So again in geriatric population, like this falls is very common here, because because neuromuscular, this musculoskeletal system for them is not that much strong, means the chances of fall will be there. Okay, so if any fall is there, any fall, this type of emergency is there, don't jump to again means you are lifting the patient. First, if the patient already fell down, you have to first go and assess is the head, spine or limb, whether is there any is there any fracture and all. Okay, you have to assess first. And like if or and is there any bruising or anything or bleeding, so that thing you need to assess first and avoid moving the person immediately. Okay, and if any fracture or anything is there, so that thing like you have to provide some comfort like supportive device to lift the person. You can take help from other person also, and you can give some comfortable device or pillow something to patients. Okay, and all those things you have to document also, because like in which setup that thing happened. That thing also you have to document. Okay, so this is all about falls. So next condition is breathlessness. Okay, so this breathlessness is again a common emergency. So that breathlessness, how to manage that breathlessness. So we know already, like this upright position we can give, so there will be the good lung expansion. But sometimes caregiver don't know this thing, like some of the conditions just by changing position itself we can manage the we can handle our patients. Okay, so if the breathlessness is there, like we can provide the upright position to the patients. Okay, and like good lung expansion will be there, and it will help in it will help in their breathing process. Okay, and we can maintain the open airway. If any tight clothing is there, we use tight clothing. And if any tight clothing is there, that thing should be loosened up. And like we can provide small sips of water also, because it will moisten the throat of the person, and it will help in the breathing process. Okay, and if the person is in a home setting, sometimes we are familiar with the medication person is using, like if any inhaler the person is using, so that inhaler also if needed we can give. Okay, so in this way we can manage the breathlessness in the patients. So this is all about the emergency conditions, like how as a caregiver, like we can take care of our patient, like if any kind of this emergency can occur. So at least they are very well knowledgeable or able to handle this type of emergencies. Okay, so next, like practical skills. So how this thing to the caregiver as a trainer we can teach, like by the demonstration, like how to do CPR, and by providing the safe positioning, like during if it is seizure or breathlessness, by changing position itself we can take care of our patients. Like it is again very helpful in that condition. So about positioning, this thing we can tell. And like all first aid related things, if any emergency is there, any bleeding is there, sometimes shock is because of any severe bleeding, so that thing how we can manage, like we can first we have to stop that bleeding. So we got the pressure should be applied on that area, so that at least we can stop the bleeding. And like that will be the first aid. And after that, if to manage shock, the extremity can be elevated. So like that, the position with position and all, by doing some first aid, giving some first aid treatment, we can take care of our patients. So next, trainer emphasize. So as a trainer, what all things we have to emphasize? Like first, for the caregiver, it is very necessary, like caregiver, because when any emergency will occur, that time some the caregivers are, if caregiver itself will be anxious, how they will take care of their patients. Okay, so that time like they have to be with knowledge only, they will be very well prepared, and like how what they have to do in that particular type of kind of scenario or emergency. And first they have to be calm instead of jumping and doing everything, if they are anxious means the mind won't work that time. So they have to be very well prepared. So as a trainer we have to prepare the caregiver first, and how calmly they can save the life of person. Okay, so that thing is important here. Next, avoid unsafe practices, like giving water during the season. So that is again should be avoided, and that thing we have to tell them, because these patients, if our trainer caregivers are educated to means to take care of patients, means that time they know means what to do and what not to do. That is also very important. Okay, next, caregiver reassurance is essential in emergency. And the caregiver reassurance is not only important for the patient only, sometimes it is important for the family also, because everyone will be anxious. Patient is already suffering, and family members, if they are means anxious, again if at least one person is there to take care of everything, means they can give reassurance to the family member also and to the patient also. So as a trainer we have to emphasize the importance of all those things, okay, to our caregivers. So next, training approach. So how we can train regarding this to our caregiver, like with some role play, we can create some scenario. With that we can teach to our caregivers, and like a demonstration of positioning and how the first aid should be given in any kind of emergency. So that thing with demonstration and role play can be taught to our caregivers. So next, so this is all about my first topic of managing emergency. So the take home message is, for the caregiver here is preparedness, calm response, and timely help can save the lives during emergency. So especially for the caregiver, it is very important to take care of these emergencies. So this is all about my first topic. So now we are going to move for the second topic. So before that, if any doubt is there, you can ask. Otherwise, we will go with our second topic.
I think most important thing for emergency is that they have to connect with the healthcare provider immediately, raise the alarm and connect with the healthcare provider while they are taking care of all this, isn't it?
Yeah, sir.
Yeah, I think they have to know about all this, and immediately with this, parallelly they inform the healthcare provider that okay, while he is arriving, they are there, but information to healthcare provider or the hospital is equally important for them to learn. Okay. Yeah, you can, Manolita, please continue.
Yeah.
But I think we have time constraints because we'll have the sessions with the participants also. So,
Sir, I will
please
try to
continue.
keep it
Yeah,
fast.
please continue. No, not fast, but I just wanted you to know about. Thank you.
Yes. Okay, so our next topic of this module is managing medical equipments. Like in this, we are going to discuss mainly about hearing aids and the BP apparatus. So our learning objective of this topic is like as a caregiver, like how to use and maintain the hearing aids, like and the blood pressure monitoring devices safely. Okay, so for a caregiver, it is very important like how to use and maintain all this equipment, because nowadays in a home setting these things like commonly people are using like hearing aids, blood pressure monitoring devices. Again, in the next topic I will tell about the glucometer and the nebulizer device. So in this devices will be available in the home setting also, and as a caregiver they should know like how to use and maintain those devices properly. Okay, so so like let's the key content area here is hearing aids. So hearing aids, like our geriatric patients, they are having problem with the hearing issue, like hearing issues will be there. So like majority of them are using hearing aids sometimes. So like if they are using, like how to take care of all those like equipments. So like if they are using any such type of devices, first of all it is very important for the caregiver like to see the manufacturing guidelines and what instruction they are using, they are telling to use that device. Okay, sometimes we are just taking the equipment out from the box and directly we are starting using. We are not reading the booklet which they are providing. Okay, if we are following that thing with that, like for a long time we can use those devices. Okay, so next, like if the person is using that thing, so daily cleaning of this hearing aid is very important. So sometimes because of uses, the earwax will accumulate in that, so proper cleaning and removal of earwax is very important that time. And like so we can keep some and battery care is also important here. And when and we have to keep some spare battery also, like if one is not working, so by that time like another one we can use, so extra spare battery should be also there. Next, to proper insertion. So proper insertion are like how this hearing aid should be inserted. Like we need to push the this pin a little bit backward. Okay, and this hearing aid little bit means inward. Okay, so with that we can insert this hearing aid properly. And like before inserting, we have to keep this device off, so that and like after inserting we can just raise the volume slowly. Okay, so and we have to ask the patient like at what volume they are feeling comfortable, and throughout the process also we have to monitor like they are okay with that volume, so that volume adjustment should be done properly. Okay, so that thing with the hearing aid as a caregiver we have to take care. Next, the BP measurement. So BP measurement nowadays, like in a home setting, people like this hypertension cases we can see frequently. So like people are using BP monitoring devices in their home, especially the digital devices they are using in their home setting. So like as a caregiver, like they should know the normal ranges, like how much the systolic will be and how much the diastolic will be. Okay, so systolic, it should be 90 to 120 mm of Hg, and diastolic from 60 to 80 mm of Hg. And like so this will be the normal range. Next, the devices. So this BP measurement devices like mercury is there, aneroid device is there, and digital one is there. So digital one is the most simpler one, like anyone, even the layman person can use that thing. But the most accurate one will be the mercury and the aneroid device. Okay, so but while we are handling this mercury device, we have to be a little bit cautious, because once this device will broken, the mercury will be there that inside, again it will add hazardous to the environment. So while handling this type of devices, they have to be very cautious. Okay, so like digital one is the simpler one which they can use in a hospital setting. But if still they want to use this, or they are willing to use to get the accurate BP measurement, like this mercury devices also, which is a gold standard, they can use. Next thing, like correct cuff placement for, like, to the caregiver, we have to tell simply sometimes the patient, they are just tying the cuff, they are not knowing like where to place that cuff. Okay, so we have to teach, like it should be above 2.5 centimeter above from the elbow crease. Okay, and it should not be too tight or too loose, because at least 2 finger gap should be there after tying that BP cuff on their hand. Okay, so next, the inflation. So inflation, how much, like if they are using any aneroid or mercury, in that they have to do in that, how much they have to raise the pressure, like where they are not getting, like Rodkopf sound will be there, so they have to use stethoscope to auscultate that sound. And if the first sound where they are not getting any sound, from that they have to raise 20 to 30 mm Hg more. Okay, and like in a majority of cases, like, or normally we can raise to 160 to 180 mm Hg. So that much inflation should be done. And again, deflation. So deflation, like slowly that thing need to do, and that time we have to check the first sound and the last sound. The first sound, like that time, like when you are started getting any sound, that will be the first Rodkopf sound, that is the systolic one, and the last one, that is the diastolic one. So that reading they have to take, and they have to write in their diaries. And when they are going in hospital, or for the prescription, or to meet their doctors, that time they can show their diaries. Okay, so that thing, with the BP measurement devices, they have to do, like how to measure all those things. First, again, the when they are checking with this mercury or aneroid devices, again they have to auscultate those things, so that sounds, so the calm environment should be there, so that no noise will be there, and they can get the accurate reading. Okay, next, proper arm and leg position. So the arm position, like it should be it should be at the level of the heart. It should not be too above or too low, because if they will keep it too high, it will, if it is high, it will show the low reading, and if it is low, it will show the high reading. Okay, so proper position is important here. Okay, so this is about these two equipment. So now the practical skill. So to the caregiver, like as a trainer, we have to teach, we can demonstrate, or they can also, reverse demonstration will be there, like how to insert and adjust the hearing aid devices, and how they can, like step by step, the BP measurement practice we can tell them. Okay, so practical skill, that thing we can inculcate in our caregivers. So trainer, what they have to emphasize, like the hygiene and the device specific instruction. As I already told, they have to see the device specific instruction, because that is very important for the usage of that equipment for a long period of time. Okay, and hygiene related to that equipment is very important, otherwise the patient will get infection if they are using any hearing aids. Okay, ear infection they can get. Next, accuracy in BP monitoring prevents the mismanagement. Okay, so as a trainer, that thing they have to emphasize to the while educating their caregivers. Next, training approach. So like demonstration, they can take the volunteers and they can demonstrate and supervise practice of BP recording. Okay, so that thing also we can teach to our caregivers, and how they are doing the reverse demonstration we can do, and we can, in that way we can supervise the practice of checking the BP measurement. So the take home message of this topic here is, for the caregiver, is that proper use of hearing aid and BP apparatus improve communication and health monitoring in older adults. So like hearing aids, like if the patient is not able to hear, like if the geriatric patient, or if any patient who is using hearing aid, if they are not able to hear that thing properly, there won't be proper communication. So again, they will feel like irritated. Okay, so that thing, once they know how to use that hearing aids, like that thing, they can they know how to use that devices, and how in that way they can improve their communication if they are communicating with their any family member of anyone. Okay, so this is about my second topic. So again, in next topic, that is managing equipment, medical equipment. Again, in that we are going to discuss about glucometer and the nebulizer. Okay, so our learning objective here is perform safe glucose monitoring with glucometer and administer inhaled therapy using nebulizer. So this is the objective of our this topic. Okay, so glucometer. So glucometer, this device, also in a home setting we can see this thing frequent, like anytime we can see this thing. Patients are using different companies of glucometer also. Again, they have to see the manufacturer guidelines, like how to use that thing, and for this devices also batteries are needed if any, so they have to keep some spare batteries also if they're using these devices, like if any emergencies is there, so that time they should have spare batteries also, in case if that time if it is needed, so spare batteries, well, they can use that time. Next, checking the expiry of strips. So sometimes we are ignoring this thing, but there is the expiry date of strips also. Okay, so they have to check that thing, otherwise they will get false negative result of using that expiry strips of glucometer. Okay, next, proper storage. So this glucometer devices, like in a dry or clean places they have to store, and like along with this glucometer devices, some lancet will also come, so in that we can adjust the depth also, like a majority of times people are using 2 mm depth of this lancet for pricking. Okay, so that thing they can adjust. And next, like safe disposal of lancet. So in my last topic about the disposal of this home waste, medical waste, I will tell. Okay, so next, stepwise testing and the lodging result of that thing we have to like caregiver need to do. So what, like at what time they are checking the blood glucose level, like before breakfast or after breakfast, before lunch, after lunch, or before dinner, after dinner, that thing they have to write the result in a diary. They have to maintain one diary, and after breakfast or after lunch or after dinner also, if they are doing, at what time they are doing, like post prandial, like the 2 hours gap should be there, so that thing they have to follow. So this is related to glucometer. Next device is nebulizer. So that is also, we can see this thing in hospital home setting frequently. Okay, so that thing, as a caregiver, they should know how to assemble these things correctly, and like how to add medications in that. Okay, and use the use of mouthpiece and mask along with nebulizer, how this thing can be done. Okay, and ensure the upright position of cup, so that there will be the better flow of medication in the nose or in the mouth. Okay, so that thing we have to maintain. And like 5 to 15 minutes each session should be there. Again, it will depend upon the severity of disease. So like 5 to 15 minutes each session should be there. Okay, and post use cleaning and storage. So post use cleaning and storage, like these devices the patient is using on their openings like mouth and nose, so again chance of bacterial growth will be there. So what they can do, they can just clean with the lukewarm water, and they can keep in sunlight for drying that thing. Okay, and sometimes the medication which they are using for the nebulizer, the side effect will be there, the jitteriness and the discomfort from the noise. That thing also we have to monitor. Okay, so next, to the like what all practical skills we with that we can teach to our caregiver, like with demonstration of glucose testing with finger prick. Okay, so this thing, with that they can demonstrate, and reverse demonstration also we can see. Okay, and practice assembling and using nebulizer, like how to assemble all the equipment, how to attach, where to attach, that thing they should know. So that thing also in a practical skills we can check, and how they are using nebulizer, that thing also. And proper disposal of sharp. So that thing in my last topic we will discuss. Okay, next, as a trainer, what all things you have to emphasize, device specific protocols are very crucial. As I already told, like device specific manufacturer guidelines will be there, and they are instructing means how to use what. So that thing we have to follow. Okay, next, caregiver must follow doctor's instruction for dose and timing. Okay, so if medication, if they are using with the nebulizer, so they have to follow the doctor's instruction with the dose and the timing. Okay, So the training approach, what it should be like hands-on practice with glucometer and nebulizer. So they should know means how to handle this glucometer, where to insert this strip, and how to measure. So with glucometer, one important thing, like in a home setting, I had seen the majority of time the patients are doing mistake, and sometimes caregiver also not knowing this thing. Like the first drop, which is after pricking, the first drop which is coming directly from that, they are checking the reading. Actually, that is wrong practice. So first they have to, after cleaning the finger, first they have to wipe the after pricking, the first blood drop which is coming, that thing they have to clean, and with the other blood drop they have to check the reading. So that is the correct method of checking this blood glucose level. Okay, so that thing, hands-on practice, with that hands-on practice we can assess for our caregivers. So this is all about my third topic. So the of managing medical equipment like a glucometer and the nebulizer. So the take-home message for the caregiver here is accurate glucometer use and the proper nebulizer handling ensure the safe diabetes control and the respiratory care. So next, moving to my fourth topic, that is household medical waste disposal. Okay, so that is very important topic, because in a in hospital setting we are very, means we are following so many codings for discarding our waste. We are doing we are taking care of segregation and everything. But in home setting, when it comes to home setting, we are taking this topic very lightly. Okay, so we have to be like, in home setting also, like caregivers should know like how to discard the waste properly in a home setting also. So our objective of this topic is understand safe disposal of medical waste at home. Okay, so key content area here is like general waste, like how like routinely or frequently you are discarding your regular trash. With that also we can discard the medical waste. But with some particular type of waste, we have to be little bit cautious. Okay, so when we are going to handle any sharp item, so that sharp item, if like whatever the commercial container is there, like we can take the detergent bottle, the thick plastic bottle we can take. Okay, so in that we can, whatever the sharp we are using for our patient, that thing we can discard in that, and we can label that bottle as a sharp. Okay, and try not to recycle that bottle. Once it is finished, we have to just cap it, and we can just keep with our regular trash, and with that only we can discard. So try not to use that plastic bags again, plastic bottles again. Okay, and that label should be there, so that if next person is who is going to handle those garbage outside of your home, they will be little cautious while handling while handling this type of waste. Next, contaminated cloth or bandages. If the patient is if the patient is like, if you are using any cloth or bandages for your patients, so so that thing, and if any transparent plastic sealed bag is there, in that you can put all those waste. Okay, and it should not be mixed with your regular, because this thing like in transparent bag, it will be visible to the other person also, like what is there inside in that bag, so they will not open and touch that thing from inside. Okay, so in that way we can discard our contaminated cloth or bandages. Next, the medicine. If any medicines are there in a home setting, so what we are doing, if we are not using, we are giving that medication to the other person. Okay, so if that same medication is prescribed to the other person, so and same dose and is there, so that thing we can give. But better, if you are not going to use that medication, you can return this back to the drug storage centers. Okay, there are some storage center, they are following the policy, they are taking the medications back also if people are not using. So that thing can be done with that. Again, if the medication you are not using, try not to flush that medicines in the washroom or in the toilet, because and that thing you can just mix with the coffee ground or the cat litter, so that this thing should not be accessible to the any human or the animal outside the home. Okay, so in that way the medicines can be discarded. Next, cleaning. So cleaning, like in a home setting, if any person is sick, and so in that in home setting, if you are normally cleaning with water, it is not sufficient. So you have to as a caregiver, you have to see, like you have to take care, like you can teach the family members to use some disinfectant services or the bleach solutions to cleaning in the home setting. Okay, next, special waste, and like the radioactive waste. So like for the radioactive waste, you have to be very cautious, because this is, again, if you will discard anywhere, the other people will also get the radiation from it. Okay, so we have to take to discard that particular radioactive waste. Okay, and what they are telling as per their instruction, you have to discard accordingly. Okay, so about these things like the practical skills, like how we can teach to our caregivers, like with the demonstration, or we can show like a sealing of contaminated waste in some transparent bags, and so in that way the practical skills we can teach to the caregivers. Next, the trainer, what as a trainer need to emphasize, like safety of children and pets is very important, because this discarding this waste again here and there, again it will affect, it will add some infection to the environment also, and it is means it is especially for the safety of children and pets also, it is very important to discard that waste in a proper place. Okay, and environmentally responsible disposal. So as a caregiver, like we should not only focus to our patient, like we are treating our patient and we are adding some infection to the environment or something. So we have to be very well cautious, this waste, if you, how you have to discard, because outside also if any person is going to handle that thing, they will directly touch that thing, and you means you are giving that same infection to some other person also. So as a caregiver and as a trainer, we have to emphasize, we have to inculcate all those things to our caregiver also, how they can take care only, not only to their patient, and how they can take care of their environment also. So that thing also we have to inculcate in our caregivers. So next training approach here is like with case scenario of managing waste at home, like we with the case scenario we can teach these things to the caregiver. And next, show example of sharps container alternatives, like container alternatives, like what all plastic containers will be there, and what all they can means what all things they can use for that. Okay, so in that way we can teach, okay, to our caregivers. So next, the take home message of our this topic of disposal of medical waste at home. So like for the caregiver here is like proper medical waste disposal protects caregiver, family, and the community. Okay, so as I already told, we should not only focus on our patient and only to our family. Sometimes we have to be take care of our community also while taking care of our of all those things. Okay, so this is all about my presentation. In module 6 we covered the 4 topics of managing. First, the managing emergency. The second one is managing the medical equipment, like in that we discuss about the glucometer, BP apparatus, hearing aids. So all these topics we covered, and the nebulizer also. And the lastly we discuss about the how to discard this medical waste at home. So this is all about my topic. So thank you, and thank you for the patient listening.
Thank you, Manolata, for your nice presentation. If there are any questions, please feel free to write in the chat box. Yeah, we will have to move to the next session, because now we are really running short of time, looking to the assignments lying ahead. So I'd like to invite Nikita for her presentation on self-care for caregivers, which is equally important, because we need the self-care of the caregivers. Caregivers, they usually ignore their own health and themselves, and that's why it is important to take care of them to avoid caregiver burden and caregiver burnout. Over to you, Nikita, for your presentation. I'll request that we will have to keep it within 30 minutes. We will have to keep it for within 25-30 minutes. Our participants are all learned participants, so it won't be difficult for you to finish it in time. Okay, over to you, Nikita.
Good morning, everyone. I'm Nikita. Good morning, everyone. I'm Nikita from AIMS PB Nagar. Today, I will be presenting the topic of dementia care, caregiver care, and stress management. So, as you can see, We will be covering two modules, that is Module 7, Self-Care for Caregivers, which covers the topic of common challenges of being a family caregiver. Topic 2, Caregivers to Care for Themselves, the balanced diet specifically tailored for the caregiver, the body mechanics that are required while giving care to the patient, and getting a good sleep. Module 8 covers dementia care and stress management, under which we will be studying topic 1, dementia care, and topic 2, stress management. While covering the topic 1, common challenges of being a family caregiver, it is very essential that we manage the care of the patient as per the need. So, as per individual need, we have to focus on our learning, considering the understanding the common difficulties faced by the family caregivers. The difficulties like managing their own time, their health, their exercise, their mental well-being, and second, we can identify the impact on the health, finances, and emotional well-being. The impact on health can be long term on the caregiver, so it is essential that we identify the impact and change the things accordingly. The budgeting, the mental well being of the caregiver is equally essential. The key content areas of this module is the time management and loss of personal activities. As you know, while providing care for the recipient, care recipient, it is important that we manage the time of the caregiver as well, so that they get some time for their personal activities and also involved in their hobbies. Health issues like stress, depression, chronic illness, injuries. While providing care to the recipient, many of the times because of time shortage, the stress can be present in the caregiver, accumulated with a lot of depression, mental illness, and injury while providing care. Emotional burden, lack of privacy, and financial strain. The emotional burden can be a toll on the caregiver's health. The privacy is lost as there is not enough time for the caregiver to devote to their own life. Financial strain can be a big toll on the caregiver as the needs of the care recipient can be financially burdensome for the caregiver. Sleep deprivation and guilt about asking for help. Many of the time, the caregivers are not pre-prepared for the caregiving, and they, even if they are well prepared also, as per the recipient's need, the continuous demand of the care has been revised. So ultimately, it's the lot of asking for help and requirement of help may not be given by the caregiver, and that guilt of asking for help may be present. Under all the situations, stress, depression, and sleep deprivation can ultimately result in a bad health for the caregiver. Social isolation, psychological issues, and work disruption. Due to the continuous involvement in the recipient care, the social isolation of the caregiver is possible, and it can lead to the isolation and ultimately affect the work profile of the caregiver as well. The importance of respite care services. The respite care service is like a temporary break from the caregiving activity, which can provide a relief to the caregiver. And it is important to repeat respite services as required and even intermittently so that it is less burdensome for the caregiver. Now we'll be seeing the practical skills and procedures that are required to understand. First, we should recognize the signs of caregiver burnout. The signs of caregiver burnout can involve like having depression, frequent burnout, the caregiver's behavior, the emotional outbreak can give us a sign that the caregiver is being burdened and is not able to cope with the continuous care needed. Identify when to seek support or it's important that when the caregiver is not able to perform the care need required and not able to balance out the caregiving with the personal life, they should seek support or they should approach any respite care service so that they can take care of their well-being as well. Role of caregiver, training emphasis. The trainer should normalize caregiver stress. So we should maintain the understanding and empathy of the caregiver who is providing the care to the recipient. We should normalize that it is acceptable that a caregiver can feel stress, and we should encourage them to seek help and self-care without guilt. It can ultimately help the caregiver in continuing for prolonged care and even provide the care with utmost care. The training approach. So we can make them have some case discussions on caregiver burnout. Like we can make a scenario and we can have small group sharing of challenges of the caregiver as well, so that the recipient is able to understand what are the requirements and even the caregiver can express what are the challenges being faced. So by having this group sharing activity, the caregiver burnout can be understood and we can identify how to correct those burnout and we can prevent it in future. Take home message. Family caregivers face physical, emotional, and financial stress. So ultimately, we have to provide respite, that is, temporary break from the continuous strain of caregiving by supporting them and providing them self care essential, which are which are helpful in sustaining their role in the caregiving activity. So we have to make sure that the family caregivers are having the well-being in total, that is physical, emotional, financial, social, so that they don't have any isolation and any burden to continue the care for the recipient. Now, coming to the topic second, caregivers to care for themselves. As you know, it is very important that the caregivers care for their own self also, so that they can continue the care for the recipient. Our learning objective is learn the self care strategies to maintain the personal well being and understand the preventive healthcare and physical activity needs. We will be focused on the self care strategies that can be applied in the caregiver's lifestyle so that their well being can be maintained over a long period of time. The key content areas are physical health, which involves balanced diet with all the nutrients required for the body, adequate sleep, and regular activity. Regular activity can involve brisk walking, at home exercises, keeping the caregiver active in their life, and preventing any sleep disturbances by overburdening them. Stress management, journaling, humor, counseling, relaxation techniques. Journaling helps to reflect the internal thoughts and anxiety present in the caregiver. So, journaling can help the caregiver to note down all the important points and ultimately reflecting to the points that are causing stress in the life. Humor. By using humor, the caregiver can sublimate the internal feelings and take it in a positive way. Counseling can also help to manage the stress in the caregiver with the combination of relaxation techniques and breathing exercises. Preventive healthcare, like immunizations for the caregiver, because if any communicable disease is present or any injury can happen, it is important to have immunization to the caregiver as well. Regular checkups of the caregiver is an important aspect because while providing care, they are occupied in the recipient's need and they might neglect the need of themselves. So, frequent regular checkups for caregiver is equally essential. Mental health screening. While giving care to the recipient, it is important that the caregiver also screen themselves if they are suspecting anything like depression, anxiety, trauma, because it is usually associated with the care that they are giving to the recipient. Physical activity like home based exercises, walking, daily chores, and gradual build up. We have to make sure that we motivate the caregivers to have a gradual build-up in their physical activity because it can be physically demanding for the caregiver to give care and at the same time take care of their own exercise as well. So we should tell them exercises which are practically possible for them, making it possible that they are able to perform the exercises in their limited time which they are having for themselves. Practical skills and procedure. We should teach the deep breathing, yoga meditation exercises to the caregivers. It involves the basic breathing so that the body can relax and get rid of the stress present because of the caregiving demands. We can even use the yoga and video lectures that can be a simulation for the caregiver and they can imitate the same yoga and meditation postures in their practical time possible. We should demonstrate simple home exercises. We should show the caregiver the home exercises that are possible, and we should demonstrate how it is possible to do it at home as well. as the time limit can constrain the caregiver to go in the gym or any kind of physical setting to go separately and perform the exercises. The role of caregiver and trainer emphasis. We as a trainer should stress that self-care is not selfish. We are often associating self-care that it is selfish and the caregiver is taking out time for themselves. But we should always emphasize that if the caregiver is themselves well and they are able to take care of the recipient, then only it is prolonged possible that the caregiver can provide care. So it sustains the caregiving capacity. So we should emphasize that the caregiver should focus on their health as well as the recipient. Training approach, guiding relaxation demo. So we can demonstrate to the caregiver how to do relaxation exercises by guiding them and by demonstrating them the exercise. During this practice, we should emphasize that it is not just a passive listening. We should ask the caregiver to repeat after us, and we should make it an active activity. Short group exercise session. We can even have a group of caregivers and trainers so that we can provide an exercise session which is practically possible and ask the return demonstration of all the caregivers and trainers. Take home message. Caregivers must prioritize self care by the help of multiple nutritional needs, proper sleep pattern, sleep hygiene, the basic practical to do exercises, the stress management by use of breathing exercises, and various activity which help the caregiver to attain relaxation and preventive health checkup like immunization and routine checkups. Under the topic 3, balanced diet specifically tailored for caregiver. As you can see, due to the caregiving demands, the caregiver needs essential nutrients and calorie-rich diet, which is also healthy in a long term to maintain the physical well-being of the caregiver. The learning objectives understand the importance of balanced nutrition in sustaining the caregiving capacity. So, we should understand why it is important that a balanced nutrition is provided to the caregiver. To maintain the caregiving capacity, it is important that the caregiver also maintains a balanced nutrition for themselves. The key content area, role of nutrition in immunity, stress tolerance, and energy. As we know, nutrition makes us facilitate the work that we are performing. So, to maintain the immunity, the fighting ability of the body, the stress tolerance, and the energy to do the tasks required for the recipient is all based on the nutrition that the caregiver is receiving. So we should do a proper meal planning, which requires small frequent meals which are calorie rich as per the individual's physical activity, balanced plate which involves various fruits which are rich in antioxidants, vitamins, vegetables, grains, proteins, so that they can give the required energy for the caregiver. Reduce the sodium intake and avoid processed food and which are having a lot of spices. Because of the caregiver's ability and the work, it is important that sodium should be reduced to the necessary limit and processed food should be avoided to eliminate any risk of cardiovascular diseases in the future and even any anxiety or stress. Hydration and mindful eating. It is important that the caregiver follows proper hydration, hydrate the body, and eat at the mindfulness. Mindfulness eating is basically when you're eating, you should focus on what you're eating instead of being distracted by another thing or any distractions or taking any stress. Healthy snacks and batch cooking tips. Because the caregiver might not have so much time that they can cook each and every time 3 meals, 4 meals a day. So it is important that they can cook something which is in high calorie category and they can make the food as per batch. Even for snacking options also, they can take the alternative of healthy snacks like dry fruits, like some chips which are made from the organic ingredients and have some jaggery, like some domestic things that can be considered as healthy snacks. Practical skills and procedure. Demonstrate preparing a simple balanced meal or snack. So we should demonstrate how they can make a balanced meal or snack that can be utilized for any emergency or when there is a lack of time for preparing a full meal. We should show the healthy portion sizes for the caregiver. So, as per the caregiver's BMI, we should decide the healthy portion size for the specific individual and what is required for that caregiver so that he can take or make a diet plan for themselves, even for a snack or even for a batch cooking. Role of caregiver or training emphasis. Nutrition directly impacts caregiver energy and emotional well being. A healthy body impacts the healthy mind. So, for proper activeness of the caregiver and the necessary energy, it is important that nutrition is well balanced. So, ultimately, the caregiver energy and emotional well being is maintained. Training approach interactive discussion on daily food habits. So, we should ask what are the daily food habits of the caregivers, and we should give them feedback if we find any point that is worthwhile changing. Group activity. Planning a caregiver friendly menu. It is also important that we sit together and we finalize some menus which are specific to the caregiver's demand and their accessibility. If the caregiver is able to have a limited access, then we have to make a menu and plan their food as per their availability and the nutritional requirement of the caregiver. Take home message: a balanced, nutrient rich diet supports the caregiver's energy, immunity, and emotional health. In total, by combination of all these factors, we can have a balanced diet for the caregiver, which will facilitate them to provide a quality care to the care recipient. The next topic is topic 4, body mechanics. Our learning objectives are: learn the principles of safe body mechanics. As you know, while moving the recipient or the patient, it is important to maintain a safe body mechanics so that the caregiver can be prevented from any injury to the body or any harm to their own self. Prevent the injuries while providing care. It is important that caregiver, while providing the care to the patient, they should not harm themselves or get into any injuries that can be short term or long term, hampering the caregiving of the recipient. Key content areas: the importance of posture in preventing back injuries. It is frequently noticed that when an individual is bedridden or they are confined to any wheelchair, while moving the patient, mostly the caregiver is getting back injuries because of the poor posture or putting too much strain on the body. So we should explain them what is the importance of maintaining posture, which can ultimately limit the chances of back injuries. The principles behind it are: wide base. We should ask the caregiver to have the legs feet apart with a wide base to the body so that the center of gravity can be limited to the lower part, and it can prevent the back injuries by having more pressure on the back. The equilibrium while movement. Avoid twisting from the waist and distributing the load onto the full body instead of just on the joints or on the back. Use legs and arms and keep the work close. So, by keeping the work close, our center of gravity can be distributed and force will be distributed on all parts of the body instead of just one part, minimizing the risk of any kind of injuries. Reducing the friction or push pull instead of lift. When we are lifting any heavy object, there are more chances of having an injury. So instead of it, if possible, we can ask the caregiver and suggest them to have a push pull, or instead of it, any rolling mechanism instead of lifting the weight. Smooth coordinated movements. The smooth coordination between all the parts of the body, the articles that we are using, that is important to avoid any injuries. Work at a comfortable height to prevent unnecessary bending of the waist or disuse of the joints. Maintain fitness. It is also important that the caregiver maintain their physical health and fitness as well. by a combination of exercises, flexibility, and mobility at their own pace in their free time. Practical skills or procedures demonstrate the safe lifting habits and the transferring techniques so that the caregiver can move the recipient as per need of the recipient and even transferring the patient from one place to another while lifting or while any movement. Practice with props like chair, bed, dummy. So we should explain the caregiver how we can use and practice the various props available, and we can do like a simulation with them so that they can get a habit of how to move the patient and how to lift the patient when it is required. Role of caregiver. Emphasize safety of both the caregiver and the patient. So body mechanics helps the caregiver to understand about themselves and even the body mechanics of the patient. Training approach, demonstration and supervised practice. It is very important then when we are demonstrating about the body mechanics, we should have a supervised practice and demonstration so that the caregiver actively understands how the body mechanics work, how they should actually perform it. Because if we just didactically tell them this is how you should move, they will not be able to understand and perform it. So we should always have a written demonstration and a supervised practice to avoid any kind of injury to the caregiver and the trainer as well. Take home message. Good body mechanics protect the caregivers from any kind of injury and promote the comfort for both the caregiver and the patient. It is very essential that comfort and injury is to be balanced out and the caregiver is able to maintain it in a long go. Topic 5, getting a good sleep. Learning objective, recognize the importance of sleep for caregivers. We should make the caregiver understand what is the importance of the sleep in their life. If they are not able to sleep properly, if their sleep hygiene is not maintained, ultimately they will not have the energy to provide the care to the recipient. We should understand up to apply the practical sleep hygiene measures so that the caregiver have appropriate sleep as per need. Key content area, impact of the sleep deprivation, like a cognitive impairment, which can help the decision making of the caregiver. If the cognition ability of the caregiver is not proper, the decision making can get hampered and lack of attention is also possible. The emotional strain. Frequently, when sleep deprived caregivers are providing care to the recipient, they are having an emotional strain with a combination of depression or anxiety. Poor immunity due to sleep is a very important factor in damaging in curing the damage while the whole day activities and restoring the body from all the stress that it has been exposed to. So if there is sleep deprivation in the caregiver, the immunity of the individual also probably will be lacking in the future and it can ultimately affect the immunity of the individual. Importance of consistent schedule and bedtime routine. This comes under our sleep hygiene that for the caregiver, they maintain a consistent pattern, a fixed schedule for their sleeping and resting. And we should emphasize the importance of sticking to the schedule, not just making it, but actually trying to make that schedule into practical life. This also helps in maintaining the recipient's schedule, as the schedule of the recipient also will get affected because of it. Optimizing the environment. For the proper sleep, we should have a cool environment, a quiet and comfortable place. If the caregiver is not able to sleep properly, we can even use white noise, which can help in the proper sleeping and in depth sleeping of the caregiver. We should ask them to avoid any screen usage before going to bed, any caffeine or heavy meal, or a lot of exercises just before going to bed. Role of exercise and diet in the sleep quality also need to be taught to the caregiver and the trainers, as it is important that we emphasize that exercise should be performed minimum 4 hours before going to bed. It should not come under the routine of before going to bed exercise performance. The diet also affects the sleep quality, so we should ask the caregiver to have a diet at least interval of 4 hours or minimum 2 hours before the sleep, so that the food can be digested properly and it will not affect the sleep of the caregiver. Practical skills: demonstrate relaxation techniques for the sleep, like warm bath or breathing exercises. We should discuss the sleep diary practice. Sleep diary practice is basically like journaling before going to bed instead of thinking about the whole day and stressing. If the sleep diary is maintained, the caregiver is able to provide more relaxation to the body and can plan their day ahead, which can reduce the anxiety in the coming days. Role of caregiver: trainers should stress that quality sleep is part of caregiving sustainability. If the quality sleep is maintained in the caregiver, it can enable the caregiver to continue the same care and even a better care at a longer run. Training approach: group sharing on sleep challenges. So we can form a group and getting the inputs from all members about the challenges they usually face while having sleep or maintaining the sleep in a go. Demonstration of relaxation methods. This also we should do a active and return demonstration so that the caregiver and the trainers are able to demonstrate the relaxation techniques that can be used to facilitate the sleeping. Take home message: quality sleep is vital for caregivers' mental, emotional, and physical health. So we have to train them and we should tell them the techniques which will ultimately help them in sleeping a better, longer, and uninterrupted manner. Now coming to the module 8, that is dementia care.
Dr. Nikita, can we keep it after a brief break of 5
Sure,
minutes?
sure.
I
Yes,
think,
yes.
dear colleagues, I think we can have a brief break of 5 minutes. So it is 12:09 right now. So by 12:15, we will be joining again. We'll restart the
Yes,
presentation.
sure.
Okay.
Thank you. Okay.
Please.
Yes,
Yeah, over to you, Nikita.
Yes. So now we will be starting our module 6, that is dementia care and the stress management. Our topic 1 is dementia care. Our learning objectives: to understand the dementia and its impact on the life of an individual. If we are able to understand what are the characteristics of dementia, we are able to make a plan and the caregiving of the individual. Learn the skills in communication, managing the behavior, and ensuring the safety of an individual suffering with dementia. We should have the proper communication, how we should talk to an individual with dementia, how we should manage their behavior, and ensure the safety as well. The key content areas are dementia as a progressive brain disorder. As we know, dementia progresses over time and it affects the behavior, the mood, and the physical aspects of the activities of an individual. So, we should take care of these in mind when we are providing the measures for the caregiver and even while caring for a dementia patient. The communication is an important key aspect in the care of a dementia patient. We should be clear, slow, patient, and maintain the eye contact while talking to a patient with dementia. The nonverbal cues also plays a very important role while providing care, as it can be facilitating in communicating our intention to the patient properly. Managing the behavior. We should identify the triggers that are affecting the patient. We should limit any kind of distractions and avoid any kind of disturbances in the routine activity of the dementia patient. It can affect the attention. That is why it is important to maintain the routine for dementia patient. We should reassure the patient and maintain the routine in a structured manner, making it the routine and scheduled activity for the patient. We should be able to handle the mood swings, the wandering possibility of the patient. A frequent association of the dementia patient is with the sundowning. As the day progresses by the evening or by the night, the patient usually feels more down, depressed, and lack of physical any energy. That is why we should plan the activities of the dementia patient also, considering the characteristics of the individual. Repetitive behavior might be present in the dementia patient, so we should plan the activity in a structured manner. The nutrition, hygiene, bathing, incontinence strategies should be applied for the patient as per the need and facilitating the hygiene of the patient as well. The caregiver support, like respite, that is temporary relief from the activity of the caregiver to provide a sustainable caregiving plan, the education of the caregivers, and support groups so that the caregiver can also take a break and focus on their well being as well. Practical skills and procedure, role play, communicating with a dementia patient. We should demonstrate and have a role play which depicts how we should communicate with a dementia patient. This helps in understanding the practical aspects of communicating with a dementia patient. Demonstrate the safe environment adaptation. It is very important that a dementia patient should be ensured with the safety and the preventions should be applied, like for risk of falling, the risk of skipping, and the patient can fall and injure themselves. So we should demonstrate how we can make patient environment safe and adapt to their needs. Role of caregiver. Care requires patience, empathy, and routine, as dementia patient might be distracted. So we have to deal with them patiently with empathy and maintain their routine. Avoid confrontation. We should avoid any kind of direct confrontation with the dementia patient. We should make them understand what is the logic behind any specific intervention and try to incorporate them in their routine. Use redirection. Redirection provides opportunity to make the dementia patient reset to their normal routine. We can do it by changing the scenery or making them understand and reassure at the same time. Training approach, role play, and scenario based discussion. To understand it better, we can facilitate a role play and put a scenario with the dementia patient characteristic, and we can have a discussion on what are the things that are required to care for patient. Practical demonstration about adapting the environment for safety. We should demonstrate what are things like fall prevention, skid prevention, and injury prevention for the dementia patient by use of the environment demonstration. Take home message: caring for dementia patient requires patience, empathy, routine, and supportive strategies to enhance their quality of life. In total, by covering all these aspects, we can emphasize on the dementia patient care and even the caregiver's ability to provide the care in the patient. Topic 2: Stress management. Learning objective: understanding the stress and the various coping methods which are used by the caregiver in a long run. Learn the practical relaxation techniques like breathing exercises, body relaxation, intermittent relaxation, yoga, and meditation should be inculcated in the caregiver's routine. Key content area: recognizing stress. It is very important to recognize the stress in an individual's environment, like physical, by fatigue, headaches, emotional, like anxiety, depression, sudden outburst of emotions, behavioral, like irritability, withdrawal. These can be noticed in the pattern to recognize the stress. Coping strategies: time management. To cope with the stress, we should have a proper time management and schedule for the caregivers. We should incorporate respite care, humor, exercise, social support, and professional support as required. Relaxation techniques like deep breathing, muscle relaxation, journaling to sublimate the thoughts, meditation, mindfulness, and healthy eating. Practical methods: methods like walking, pet therapy, music, gardening, and inculcating in the hobbies can provide a relief from the stress to an individual. Practical skills: we should demonstrate the deep breathing exercises to the caregiver, and we should ask them to practice guided muscle relaxation. Guided muscle relaxation involves the guidance about focusing on one muscle at a time, using it and then relaxing it, ultimately affecting the full body relaxation, and it helps in reducing the stress in the caregiver. Teach the journaling prompts. Journaling prompts are the guide which are helpful in understanding how we should jot down our thoughts and the internal turmoil that is going on in a journal. This can help us find the faults and any lacunas that the caregiver is facing during the time of care. Role of caregiver. Trainers should encourage building stress management into their daily routines. This can ultimately affect the quality care of the recipient and even the sustainability of the caregiver's care. Training approach. Group guided relaxation session can be arranged with the written demonstration, journaling exercises with the prompt teaching, and the guide for maintaining the journals should be taught. Take home message: stress management is essential for caregiver resilience. Simple daily practices strengthen health and well being. Thank you.
Thank you, Nikita, for summarizing this very important topic. And we are lucky to have as our participants with us today from the Alzheimer's Society of Indonesia. And I think we'd like to hear from them also about dementia care sometime. If they wish, they could give their comments right now also. we have one more important session left with us, and that is about legal aspects, elder abuse, and documentation, for which I'll request Dr. Mona Sundari to take us through this particular part.
Yes, sir.
Okay.
Thank you, sir. And as I am also very eager to see the micro teachings, I will take less time to summarize this topic, what is there in this module. Okay, welcome to all again. This is the last session from our end. Then we'll be having the practical session. So I'm presenting the course week content, legal aspects, elderly abuse and documentation, which has a four topic, legal aspects of care, managing and preventing abuse and neglect, because this is also one of the legal aspect, which involves legal aspects, and record keeping in caregiving, managing a person nearing the end of life. So, and this first topic is legal aspects of care. It's very important to understand the importance of financial will and advance directives, as well as final wishes of the elderly patients by the caregivers, and recognize the caregiver's role in legal planning. Key content area, the caregiver should help the elderly persons to plan their financial will, the distribution. It's like, for example, how their property will be distributed, and they should avoid probate. The probate is nothing but the court will oversee the property distribution of the person. No, that should be avoided because it costs unnecessarily for the person. So this financial aspect should be taken care by the caregivers. And adverse directives, usually some jurisdiction used to combine living will as well as medical power of autonomy to save the cost, but it can be written separately also. What is living will here is what treatment preferences the caregiver, the elderly person required, should be written, and who should take the decision once the caregiver is becoming sick. So those things, what is the role of a caregiver is helping the person to do these things, these legal aspects. Not, you should not influence, or you should not do it for him. You should help the person, guide the persons, and provide whatever possible solutions that he can provide, but you should not influence the decision of the elderly persons in taking the decision of making the financial will and advance directives. And the caregiver also should ensure the final wishes of the elderly person is fulfilled. It could be how their body should be disposed, how what is the ritual he want during after his death, and whether after the death whether his organ need to be donated, or it can be buried, or how you want that that will be already discussed with the caregiver, and that plan should be executed by the caregiver. And additional consideration is, we may think that the person is very sick and you return the financial will at advance directives. Sometime, luckily, he may become healthy and his life may get prolonged also. That time, it's must to periodically revise the financial will and advance directives, and it is responsibility of the caregiver to remind the elderly persons that this need to be revised, because almost 6 months over, because the mind can change at any time. So that should not be the permanent bill that I have written, so it cannot be changed. It can be changed as long as the person is alive and he is able to make his own decision. So that help we have to provide, and this document should be kept confidential. Only when it is necessary to review, that time only should be revealed. Until that, it should be kept confidential. The practical aspects of this topic is and demonstrating how to keep the legal documents organized and accessible, because this financial will and advance directives are very important legal documents that should be kept secured, and it should be written well and guided well, organized well. And how to initiate sensitive conversation with the families when the person is end of life. That's the reason he's writing all these legal documents. Then it is a condition situation where family members may not ready to accept such a kind of a decision by the elderly person. They emotionally feel weak. So how you caregiver should know how to convey the importance of this information to the family members. The trainer emphasis will be caregiver supports but do not decides, and naturality and confidentiality as very key area here. You should not take any decision, and the aspect of making the legal documents for elderly, he can only support, and his role is to maintain the confidentiality. of the documents. Training approach could be case-based discussion and handling advanced directives. So you can demonstrate how that can be done. Take home message will be caregiver ensures that legal documents reflects the old person's wishes. So it should remain updated periodically and are respected with confidentiality. As the person is believing you and giving that much valuable things to you, like financial will and all, it should be dealt very carefully, and it should not be disclosed to anyone, because respecting the wishes of the elderly person who is in the deathbed is a responsibility of the person who developed the trust. Now, the second topic is managing and preventing abuse and neglect. It is a very, very neglected area. The neglect and abuse is a neglected area. We believe that they are elder, how they will be misused, abused, but they are the one who get maximum injustice sometime in the family where there is a poor support. So, caregiver must recognize the person how they are getting abused and neglected, and should prevent also, and should understand the role in protecting and reporting such kind of abuse and neglect to the concerned authorities. So they should know the different types of an abuse, because once they know physical abuse, emotional abuse, sexual and financial abuse, different types of abuse are there. Physical abuse is easy to visualize with the body injuries. We can sometimes notice it. Emotional also, by once they are isolated, being alone, we can suspect it. But financial abuse, we may never know until the person discloses it. We may not able to realize that. So it is must to know what is the different types of abuse. We believe that financial abuse is not abuse, because it is abuse because it psychologically affect the elderly person. Once his money is misused by family members, when he cannot control it, he will end up with depression. So that area need to be noticed by the caregiver. And there are different types of a neglect that he should aware: active, passive, and self neglect. Where active neglect, the family members may withdraw the care which he was receiving so far. Passive neglect will be not giving importance to the necessary things for the caregiver. And self neglect, the elderly person itself sometimes may not be caring themselves, and they will be neglecting their own self care. So this could be in any form. You need to address all those issues, and you should know what is the indicator of an abuse. It could be an unexplained injury. We can suspect that injury is not a natural due to any fall or accidents. It could be somebody who made intentional injury. And if the person is continuously maintaining a poor hygiene and having a weight loss and becoming isolated suddenly, and his financial things are irregular, so we can identify that something unusual things are happening at home, is totally neglected and abused. And you should know what is the consequences of the neglect. Why we are focusing here is that this part is because the neglect will end up with poor health, poor mental health, and it can sometimes cause morbidity, mortality, and totally they will be isolated from the society. So this is the consequences to be avoided. It should be avoided by preventing the chance of neglect and abuse. So what is the role of a caregiver here? How we can prevent it and how we can deal it is, first you develop the trust with the persons whom you are taking care. Once they trust you, they come out with the issues they are facing. So once you know what they are facing, then you can find the solution. And it is better to monitor them routinely. So whenever they get abused or neglected, we can catch that point and we can treat them on time. And educating the family members and creating awareness to the family members about the neglect and abuse is again important, because neglect may not happen only from the family members. It can be self neglect also, no? So once family members are not aware, and how they can take care of it. So it's a role of a caregiver to educate the family members about this. And financial safeguard, you should ensure the properties, money of an elderly person is used well under his concern only, but it should not be misused, and have a follow up on that. And provide a psychological support which is really required for a person who is continuously neglected. And whenever it is required, better to take a community help to because we have a social workers and supporting agencies are there, then their help is required if a person is continuously abused by family members or anybody at home. Then how you can report and respond to the abuse is immediate action. You need to first remove the person from the area where he is getting abused or neglected. Once you remove the person, you have to provide a treatment, whatever is required, and clearly write the description of the event, where it happened, how it happened, any photograph if it is possible. Everything need to be documented, so that will be useful for reviewing purpose and treatment purpose, as well as for the legal purpose. Once the person is secured, saved from the such kind of an neglect and abuse, we need to have a follow-up that same thing is not happening, and what happened to whether he recovered or not, that follow-up is also is important. The practical aspect of this is we can demonstrate how the person is getting neglected and how it can be prevented. That way it can be demonstrated in a role play way, and you can show how to document the incidents clearly. Documentation is a very important legal document. What you write, each word speaks even after the death of the person. So words should be clearly written, even should be clearly written with the date, time, who is there witnessing, the full context should be there. So this is this we have to demonstrate our documentation skill for the caregiver. And vigilance and compassion and timely action can prevent neglect and abuse and protect dignity and rights of the older adult. It is the responsibility of the caregiver, so emphasize on this point. And training approach, it's better always role play is the best way to demonstrate the skill. The take home message: preventing elderly abuse requires vigilance, compassion, and timely reporting and community involvement. The third topic. Sorry. Third topic is record keeping in caregiving. The caregiver should learn why the record keeping is vital in caregiving and should also practice the different methods of maintaining the daily records. So there are different records maintained by the caregiver that we are maintaining as a professionalist in the clinical side. What they have to monitor is daily they have to monitor and record the vital signs and the diet the person is taking, amount of fluid intake and output, some of the medication that the patient is receiving. Because that once it is recorded, there is a polypharmacy. The elderly people will receive multiple drugs. Some drug may not be required after a certain period. Sometimes dose may be need to change. So once you are maintaining this records, it's easy for the healthcare providers to review and give the input and change the medications. So the benefit of a record keeping, so we all are well aware, and tell the caregiver also why it is important, how it is going to easier their work, how it is going to reduce their stress. Because once the caregiver wants to go to take a rest and he want to take a break, and that time somebody is coming as a substitute in his place, this record will speak for him, and from that he will get a information and continue providing care. So there are huge benefit of maintaining the records that clearly we need to intimate to the caregiver. And there are caregiver notebook which is comprehensively prepared. The template will have the scope for writing the medical history and date of appointments and care routines. Everything is clear. There are different types of caregiver notebooks are available, ready-made templates, so that we can show to the caregiver, and anything which is best suitable to their patient he can adapt. And digital record is far better than doing having a manual record. We can train them on using the digital records also, and you can make them to we need to demonstrate how to use the digital record and value of the digital record. And practical skill in this area: demonstrate sample caregiver notebook, how to document on this notebook, and teach simple record keepings, either a manual and digital. And then what you have to encourage here is the discipline and consistency in maintaining the records. Not just one day writing and next day not writing, because it won't show the continuity of the care. We may not able to catch the real changes in the body, physical condition of the elderly. So it's must to write it properly. And records empowers both caregivers and care recipients, because it provides rich of information how the changes are happening in the person's body. And training approach could be a demonstration of writing the care diary. And take home message will be: effective record keeping improves monitoring, communication, and caregiver confidence while reducing the stress. Because how it improves monitoring, when we know that yesterday's temperature is like this, and when after giving the medications it is coming down, we can see that the medication is responding and is improving. And the same thing, when the healthcare provider is noticing, it will be a communication media for the healthcare providers to track the person's health, So it is acting as a communication media. So once we are seeing the progress of the person by reviewing the records, the caregiver will get confident and he will do the best. And it will reduce his stress and he will develop a confidence. Once you develop the confidence, your stress will be reduced. The last topic will be managing a person nearing the end of life. The role of your learning objectives will be recognizing physical and emotional changes at the end of life and providing compassionate comfort and dignity for them. The key content area, you need to realize the caregiver should recognize the symptoms which is observed during the end of life care. It could be the person will go for long sleep and he will not have appetite. He will be more confused and restless. He will have irregular breathing and weird sound of breathing. And he may have loss of bowel and bladder control, and temperature may rise and fall. So this is a common symptoms at the end of end life. Once they realize the symptoms, the symptom-based care only they have to provide. So how they can manage the prolonged sleep? So it is better to allow the family members to visit the person once the person is awake. That is one way. And the presence of a family member is more important than engaging them in the conversation, because sometimes it may cause distress to the elderly who is on deathbed. And appetite, how it can be managed is you can provide the food which is thick and liquid, easy to swallow, and little food you can provide. And nutrition is less important than comfort. At that time, don't force the person to eat more, because that time it's not the time to maintain the nutrition balance. It's a time to provide them a comfort. And oral care, how you can provide a oral comfort is they will have a dryness of mouth, because wet sound of breath will cause irritations. It will cause no, you have to use a clean damp cloth and you have to wipe it up. You can apply moisturizers, and we can use the ice chips to keep the lips wet. So this is the way you can handle them, their appetites and fluid intake. We can't give more water at that time, it may cause aspiration, so sip of water should be provided. And very important to address their emotional needs and recognize it, acknowledge it. And you have to spiritually how you can help them is you can arrange some prayers according to the belief of the persons. You can make some prayers, you can call a spiritual resource persons to the home, and that will comfort them. And you communication tips at the time of end of life is listening is more important than engaging in a conversation. Listen how much you can listen. And tell the stories. Legacy activities includes like telling the story of their life, whatever happened, happy stories, recollecting the happy stories happen in their life will make them feel more comfort at the end of life. And for swallowing difficulties can be managed by the caregiver by providing their soft liquid diets, and medications can be anticholinergics can be prescribed if the person is having more secretions from the mouth. And if a food which is very easy to swallow can be given. So this is the way the swallowing difficulties can be managed. And irregular breathing, you need to monitor the pattern of breathing, how it is changing. But you should not do any intervention at that time, because unnecessarily it will cause a distress to the patients. You just monitor only, and you just be there. That itself is more than enough. It will reassure the person. And wet sound breathing, when you are elevating the person's bed to the 90-degree angle and putting the head at one side, the secretions is made right. So the wet sound breathing maybe disappear. And anticholinergics can be given to reduce the secretions. And you can give some comfort. Your presence will make them more comfort, and that way you are dealing these issues. Now, managing loss of responsiveness, even though they are not reacting to you or not responding, you should talk to them, because the last sense the person lost his hearing sense, he can listen to you. So you talk to them even though they are not responding, and have a gentle touch and touch their hands, and then you talk. And the eyes will be kept open, but they may not respond to you. You can just wipe the eyes, and you can remove whatever the person's presence in the eyes, and maintain the eye care for the person. And bowel and bladder can be bladder control, loss of control they will have, so they pass the urine. The best way to deal is an adult diaper can be used. And because of the diaper they may develop skin ulcers and all those, and skin care should be taught to the caregiver. And they can use the catheter with the help of a physician advisors. They can use the catheter. Once the catheter is placed for the elderly, And you should be very careful in maintaining the asepsis, because catheter is the root of developing an infection. And a body temperature, how it can be managed: if the body heat is high, cooling strategies need to be followed. If the body is too warm, heating strategies, sorry, when it is cool, heating strategies to be followed. When it is warm, cooling strategies should be followed. And oral care also is because of the wet breath sound, that oral they will have bad odor from the mouth, so oral care should be given. But you can't pour water so much during when you are providing the oral care. Just with a wet cloth you can provide a clean oral care. An additional consideration for the caregiver: emotional well-being of a caregiver is very important. He will get frustrated seeing the situation of a dying person, and he will get a panic, and he will be very exhausted also by providing the care. So he will be having a burnout situation. So you need to recognize, the caregiver should recognize the sign of his burnout, that he is getting exhausted. Once he recognizes, he should take a relief, and he can ask somebody to help. So he also should be guided how to handle the situation after the death, to whom to inform, how to deal the situations after the death of the care should be informed to them. So this is the key content area of this last topic: practical skill, and demonstrate the position for comfort breathing, to show how use of an absorbent pads, safe oral care. And you should emphasize on prioritizing the comfort rather than other aspects. And dignity is important, as he is not listening you, not response you can't just misuse him with the words. And your presence is more important than the care. And the family support is very very important, and ensure all the family members are available at the time, and they remain silent. The presence is important, and the conversation should not be initiated at the time. We can tell the small stories, the recollecting the happy moment of the life, but not the sad things. And that time talking about financial bills of property by the family member, all should not be encouraged. Teaching approach could be case study and supporting family during end of life care. That case study discussion can be the best way of approaching this topic. Take home message will be: caring for a dying involves comfort, compassion, communication, and dignity. Focus on quality and not cure, because this is the last day of life. Our aim is not to cure, our aim is to keep them comfort. So thank you all. This is about the topic end of life care. I was a bit fast because we need time for the micro teaching. They prepared very well. I'm sorry, but we can have a discussion. Anybody have any questions? You can just put the questions here. Anybody have anything to add?
Yeah. We have got a complete, concised component of geriatric care has been presented by Dr. Professor Lata and Dr. Mona Sundari, Nikita and Manulata. I wanted to inform everybody that the contents about these teachings are available on Care Asha app. All the contents are available on Care Asha app, which could be used to look into the details of these topics. That is one important thing. Now we are here for an interactive session for which please get prepared. Before that, I'll request Professor Ruchika ji to tell us something about assessment and feedback technique, because you all are going to be the trainers. So as a trainer, we need to know what are the assessment and feedback techniques. And we have got Professor Ruchika ji to tell us about this. And keep your all queries, questions ready for the subsequent sessions, basically. Okay, over to you, ma'am.
Thank you, Dr. Mathur. So I will be talking about how assessment needs to be done in a training session, whether it is an online assessment or it is a face-to-face training programs. The principles remain the same. The tools may vary. Okay, so you can put all your questions in the chat box if you want, and we can take them up one by one later on. So I will just share my slides first. 1 second. Are my slides shown, sir? So are my slides visible?
Yes, ma'am, your slide is visible.
Okay. So we will be talking about assessment and feedback techniques for enhancing the caregiver's learning and competency. So basically, what is the outcome objectives of my session? See, whenever you do the training, it's very important that you must tell what will be the outcome objectives of your session. That is, what will the caregivers or the trainers, what will they learn from you? What is the take home message? That's very important. So for me, you as the trainers, because for me, you are the trainers, you will be able to use varied assessment tools. You should be able to provide supportive and constructive feedback to your caregivers, and you should be able to monitor the caregiver competency online effectively or even offline for that matter. Now, why should we do assessment? Why does assessment matter in a caregiver's training program? So, it is important that we ensure that the knowledge which has been given there is retention of the knowledge, and the skill that we have taught them can be applied in their home setting or in their old age home setting or even in the community setting. It helps to find out whether it has built the caregiver's confidence. We are able to identify the gaps for improvement, whether the improvement in our training program or improvement in the methodology or how they are receiving or perceiving. What are the reasons for these gaps? And it also promotes continuous learning, because many of you are already GNMs, nurses, so you're already having all these skills. But how to upgrade them with respect to the caregivers, with respect to the elderly, you will learn through this. Now, what is assessment and what is evaluation? We should not be confused. Assessment is basically student oriented. It is for the particular information that you are trying to get about the competency and performance of a student. And it can be achieved through a number of activities. Whereas evaluation is generally meant for the program, the training program, education program. And so it means that we are trying to assess whether that training program is of any worth, whether it is a good training program or not. So that is the difference between assessment and evaluation, though we sometimes use these terms interchangeably. Now, there are two types of assessment. One is a formative assessment and one is a summative assessment. We can also consider formative assessment as a continuous assessment and a summative assessment as a term-end assessment. Now, as far as formative assessment is concerned, there are two types of formative assessment. One is a marked assessment and one is a unmarked assessment. So you will ask me, what is the reason for an unmarked assessment? An unmarked assessment is a kind of a self-assessment. So for example, we gave you this plan for the action plan. Now, while you were making this action plan, many of you may have realized that you may want to go back and see certain skills that am I audible? Okay. So now, what is the purpose? The purpose of an ongoing assessment or a continuous assessment is to improve the learning behavior. Whether it is a self-assessment or it is a marked assessment, it is basically to improve the learning behavior. It is also a way of motivating the caregivers towards improvement. Because when you do an assessment for one particular skill you do, and the caregivers realizes that he has learned this skill, so it motivates him to learn another skill, to move ahead. It is also for you as a trainer to monitor their learning, whether they are going in the right path or not. And you are also able to provide feedback to the caregivers that this is where you are going wrong, this is what you need to change. So that is why formative assessment is very important. Because if you wait till the summative assessment, your whole training program is over. And if you try to assess your students or your caregivers at that time, it's too late to try to reinforce learning, to try to have them getting motivated. So formative assessment is very, very important. Now, how do you plan effective assessment? So it is very important, as I told you, that the learning objectives or the outcome objectives are very, very important. So over here, we have put two learning objectives or outcome objectives, and based on that only we make the assessment, and based on that we make the teaching learning also. So this is a full interdependence of all these three activities. For example, I've given you an example of, how to reduce the falls. So one of the objectives of or the responsibilities of a caregiver is to be able to have fall assessment and reduce the chances of fall in a particular elderly. So two objectives I'm just taking. There will be many objectives, but just for so that we can't have all objectives described here. There'll be too much of cluttering and we can't understand. So there are two objectives I have taken. One objective I have taken to be able to recognize fall risks in an older person. The second is to improve independence, mobility, and quality of life for older adults. Once you have understood what are the fall risks, you are able to act on the risk factors and improve independence, mobility, and quality of life. Now, how will you teach these things? Because your assessment will be to achieve these outcomes, but through assessment of the teaching methods that you have done. So the first objective can be taught with list the risk factors for falls and discuss each risk factor. This is how you will teach them in either through the text form, through the video form, through the lecture form, whatever form you want. You will teach. This will be your basic content of your course, which you are going to teach them to achieve the objective of recognizing fall risks in older adults. The second objective was to improve independence, mobility, and quality. Now, again, there will be a number of teaching methods and a number of teaching inputs which will be required to achieve this objective. One simple thing I am taking, that is simple exercises to maintain muscle strength and balance. This is not the only activity that you will make them do, but this is one of the activity that we are just placing here so that we understand how to make assessment. Now, for the first activity that we have mentioned, the first teaching, learning, and the objective is to recognize fall risks, for which we have taught them how to list the risk factors and how to discuss each risk factors. So for the assessment, what we will do is we can give them some kind of assessment tools like a quiz, or we can give them a question, we can give them a video where they have to identify risk factors in an older adult. So you can have many methodologies, but you can do the assessment. The achievement of assessment will be that after getting assessed, they should be able to identify risk factors. Okay. Then the second is demonstrate simple exercises for muscle strength and balance. So they should be able to demonstrate. You have already taught them what are the simple exercises. So you will ask them, all right, now you please demonstrate some simple exercises for muscle strength. They should be able to show you. And then teach the exercises to the older adults, because their ultimate objective is that they should be able to teach them. So your third assessment tool will be to teach them to the older adults. Now, how will you achieve this? You can achieve this through a role play. You can achieve this by direct demonstration of the caregiver on a patient, that because you need to see a lot of things. You need to see how he has introduced himself, how he's talking to the elderly, how he's actually demonstrating, and then asking the elderly to perform the exercises. So you see, the second objective of assessment was whether he has himself understood the simple exercises or not, and he knows what are the steps of the exercise. The third assessment is how he will teach. So there is an extra skill that he has learned now, that the teaching of exercise to older adult, which is not just about the steps of exercises, but how he communicates, how he explains, and how he is able to inculcate those exercises, the compliance to do the exercises. There are so many things. Okay. Then normally, if you know, there are three domains of learning. So for assessment also, these three domains are very important. One is a cognitive domain, that means knowledge. So whether they have gained knowledge, whenever you are going to do any training program, without knowledge, you can't just teach them any skill. So you do need to have knowledge. You need to impart knowledge, whether you are using, because they are adult learners, you will use their prior knowledge. But as I told you, even in your group, if you see, there is somebody who is a doctor, there is somebody who is a nurse, there is somebody who is a GNM, there is somebody who is a non-medical person. So when we are going to teach all of you, then we need to take care that we have to, everybody will not have the same experience, the same prior knowledge. So we will have to begin at one basic level. So it may be, this basic level may be very simple for a nurse, but it may be very difficult for a person who is a social worker, or a person who is, who has done an arts subject but wants to go in for caregiving now. So we need to look into that how we are delivering and how we will also assess. So assessment is also very important, how we will assess the cognitive component or the knowledge component. Then we have the affective component. The affective component is the emotion or the attitude. Whether the caregiver, he knows how to do a particular thing, does he have the attitude to actually do it? So he knows how the exercises have to be done, but does he have the attitude to be actually take out time to be empathetic towards the older person, to be trying to teach them, having patience? Does he have these attributes? That is the affective domain. And then we have the psychomotor domain. Of course, the psychomotor domain is the skill. He must ultimately know how it has to be performed, whether it is how to do communication with the elderly, or how to actually have the skill to teach them the exercises. So that is psychomotor. I hope this is understood, because this is the most important thing when we are doing a training program, whether it is forming the objectives, whether it is actually delivering the content, implementing the program, or assessment of the learners. If anybody has any doubt, you can please ask me at this particular moment of time. Any doubt? Okay, I hope that I am at a level where everybody can understand. Is it okay? Can somebody respond?
Yes, ma'am.
Okay. I know you all must be tired at the end of the day, but I hope to just acquaint you what is this. Now, this is the cognitive domain. If you start from the below to the top, don't dwell too much on this. The main purpose of this pyramid is for you to understand that there are some simple things that you need to check in a particular learner. You will teach simple things and to complex things. So, for example, if you're teaching 8th class students, okay, just as an informal caregiver at home. So you will just tell them 2 or 3 things. You will just give them some knowledge. You will see that whether they will understand this or not and how they can apply. But if you are having very proficient caregivers, for example, in an old age home or in a palliative care center, then you may need the higher skill also. For example, he should be able to examine and analyze the various situations that he is facing, because every elderly over there will be having complex problems, complex issues, whether they are physical issues, whether they are psychological issues, whether they are social issues. So he may need to evaluate with his own judgment from the knowledge that you have taught him. He will need to evaluate, and he may also need to create. So all this, when he does, your training program goes to a much higher level, and so your assessment will also be at a much higher level. You will have to evaluate, you will have to assess whether he has been able to evaluate the situation or not, whether he has been able to innovate a particular design of caring for a particular skill or not. So that is how your assessment may vary depending upon your target audience whom you are teaching the caregiving, and also his prior knowledge, experience, and also what is his job requirement. Similarly, we have the various skills, the tools that you can use to test this. Just for knowledge and understanding, if you will have very simple, because this is just knowledge domain. This is cognitive domain. So you will have MCQs, you will have in-text questions. In-text means like we are taking class, we ask you a question and we expect you to reply. You have web conferencing tools, you have quizzes, you have online, offline assessments. You can also have discussion forums or focus group discussions, though this will also come in the apply, analyze, and evaluate level of the cognitive domain, in which we give them problem-based learning and we can give them case studies. So you can have these kind of things in discussion in the groups. We can also have Google Forms, like if you saw the plan and action plan, what we gave you was also a higher level of cognitive domain, and that was how you will apply, evaluate, analyze. So that is how you can give even in this. Otherwise, we can have reflective notes. Reflective notes is that, you have a case already the caregiver is working on. He writes the notes that this is what he found, this is what he thought, the challenges and the solutions that I gave you. So you will write the challenges, the solutions over here, and you will be able to then describe that. Then we have create. Create is like posters, charts, videos, audios. So this is the highest order of the domain. And so how you can check this? You will check their videos. You can ask them. You can check how well they have made the posters, because this is something they are creating. This is something that, from your knowledge that you have given them, they are making new things. Now we come to the effective domain. This is the most difficult domain to teach, and also most difficult domain to evaluate, because this is an emotional domain or an affective domain. So the simplest is receiving and responding. So he is at least not passively sitting there. Okay, like even if he's passively sitting, he's not dreaming of something else. So like all of you, it's very difficult to have this domain developed in an online class, because see, all of us are there in the online class. Out of, I do not know how many there are just now, 50, 60. How many of you are actually listening? Passively also, but how many of you are actually listening? Some of you may be doing your own work, the video may be on, and you may be thinking, all right, when required, we'll just try to, connect. Then you have responding, actively respond. Valuation will be when you will add value to already acquired knowledge. I ask you a question, I ask you how you can do this in your situation, and you reply. You reply, so means you are engaging yourself more than that. So these are the higher order skills. Slowly and slowly, when you become a facilitator, you will learn these. How to test for the affective domain? Again, you can ask the questions. The questions will be more oriented towards the affective domain. You can again have the same thing for the higher evaluation, that is the PBL and the case studies, again through the same assessments and the case studies video and all, but your subject matter will be different. Your subject will be for the affective domain. I hope it is clear. Please ask me if there's anything. Okay. Then we have the psychomotor domain. Now, psychomotor domain, again, we have a level. In the simplest level is that the caregiver will just practice whatever you are teaching them while you are doing these steps. So you are doing particular steps of, for example, bed making, and he is there and he's making the bed of the adjacent older person. As you are making, you teach him step by step. Then you have manipulation, in which he will repeat your steps but without seeing. So you have taught him by limitation, and then you tell him, now you repeat the steps. Then so he repeats to some extent, he makes mistakes somewhere he is not perfect. Then you are able to do it with precision. That is the next level, that the caregiver will now be able to make the bed himself, and very nicely with all the steps he remembers, and he does it with full refinement. Articulation is for he is able to adapt or alter or revise whatever it is. So for example, there is an elderly who is in pain. So okay, all right, he is, I need to modify that. A higher level will be naturalization, create. So there is this elderly who is immobile. He is having stroke. He is paralyzed. How do you do it? I have not taught you. If I have not taught you and you try to do it yourself, so this is reaching the level of naturalization. How do we test these skills? So the limitation or the lowest level you test by in-person demonstration, or you can do it on a dummy or a mannequin in a skill lab. You can also do it like we did during COVID. We ask you that we demonstrate you during a class, and then we ask you that you please return demonstrate. Either you prepare a video, send us to us, or you do live streaming. That is, you switch on your camera and you do. So that is also, that can be done. Now this will be done by limitation, means that you are doing, he is also doing. But manipulation, as I told you, that he will post his own video independent of your doing it. He will do it at his own time, and then he will coming to it. You can also do this by OSCE. Now, articulation and naturalization, that is, he is able to innovate, he is able to apply your knowledge. You do through role play. You do through checklist manual, and you also do through a logbook or a telemedicine. These are some of the ways that you can teach and assess. So this is the Miller's pyramid for assessing clinical competency. So you have to, go from knowing to doing. The simplest is knowing. You have taught him through, you assess simple, cognitive domain, MCQs, oral examination. Does he know the subject? So you have to begin with knowing. So there has to be some component of your assessment which has the knowing component. That is, has he actually understood? Because if he has not understood, he cannot start practicing a skill. He cannot do it. Otherwise, he'll never achieve. So you have to first test his knowledge. After that, you will know how to do it. So he knows it has to be done, but how it has to be done? So you can give him a problem-based question. You can ask him viva, and then you show him, he will show you, sorry, how it has to be done. So you give him a long case. He does the total assessment of the elderly, and he shows how it is to be done. And then he does it himself. He does it independently in a resource constrained environment, in complex situations. And then you are able to either do direct observation or through a portfolio, he presents it. And then you are able to assess that, yes, he has achieved the highest level of doing independently. These are some of the just examples how you can have some in-text questions, multiple choice. You can have, the word search. You can have jumbled words. Similarly, you can have quizzes like we give you in Google Forms. You can have some Google Forms with incorrect answers and correct answers. You can give them feedback. You can. Hello. I think somebody's mic is on. Can you please switch off your mic, please? Thank you. So then you can have some case studies, and case studies you give responses and they can give you answers. You can also have forms to be attached. You can have attaching files to a Google form, and these can be analyzed. You can ask them to make posters. You can ask them to make, the whole protocols which can be submitted. Now, what are the advantages of the formative assessment? The advantage of a quiz is quick check of the knowledge. As I told you, we are moving from simple to complex. Case discussion, how they apply to their real life scenarios. Focus group discussion, learning from experiences of peers. Reflective notes, encouraging self-awareness and deeper understanding. So you should always enhance their understanding and you should never demotivate. Now, criteria for preparing formative assessment is that it should be frequently provided so that there is a check slowly again and again. It should cover major aspects of the curriculum. It should always be in sync with the objectives. It should provide a feedback to the student. You just take an assessment and you don't provide to the student, it is of no use because the student doesn't know, the caregiver doesn't know what, has he done it well, has he not done it well. And it should also enhance his understanding. And understanding could be enhanced by giving the assessment because he needs to explore, he needs to think, he needs to discuss, for example, in a case study. Okay, so also if there's an MCQ, he tries to understand that yes, I do not know this MCQ. He may go and read again, he may explore again, but you should never demotivate. Can you please switch off your mic? There is somebody whose mic is on.
I'm not able to find him, basically.
Can you please switch off your mic, please? Thank you. Now, challenges in preparing formative assessment. Challenges in preparing could be that, it's very important that you do the relevant assessment. What happens with us as, facilitators, many times we take an assessment, we just apply it to any training program that we are doing. That cannot be done because the level of the learners is very important. So what you are going to teach is also equally important. So it should be relevant, appropriate, and to the level of the learners. The knowledge of the teacher, especially the technological knowledge, the subject knowledge is very important. You can't just give it to anybody and everybody to make an assessment. It's very important. And then sometimes for online assessment, the connectivity issues and the software issues may crop up. Availability of resources at the student's end is very important to carry out the activity. You give them, okay, do a demonstration of, bed making and send a video. Now he doesn't have access to an older person. He doesn't have access to a place where he's able to do this. So how will you expect him to do? So you must know what you can assess from the student. Plagiarism during assessment, if he is making a journal, if he is making a report, is very important. And another important thing is that your assessment should have scalability. That is very important. For example, today we have planned for only 5 students, 5 caregivers. We plan some assessment. Is your assessment scalable? If tomorrow 200 people join, will you be able to apply the same assessment tools to 200 people? Because you may want to just do demonstration and return demonstration in a class. Now that is feasible for 5 students, but you will not be able to do it for 200 people. You can't expect all 200 people at that particular short notice to be able to show you back the same skill. So you must plan according to the possibility that the number of candidates should increase. So scalability is a very, very important thing. Factors which influence the selection of tools, because if scalability is required, if your target group changes. So objective of the course, as I told you, the outcome objective is most important. And you will decide the level of your assessment based on the level of your assessments. Okay. Then characteristics of your learner. What is the language which you use, whether they have some tech literacy, whether they are socioeconomic, what is their status, can they avail the resources, and then compliance. Can you please switch off your mic? Can you please? Mute yourself.
Pradyuman Singh, please mute your mic. Or I
Okay. I think Khushbu should be able to do it also from her end, muting the mic. Thank you. And then the tool used, the tools that you used should be accessible to all the caregivers. They should be easily available. You should not give, one tool which is not accessible to anybody. So it could be an online tool. If it is not accessible, how will they do it? Then they should have effectiveness, reliability, and efficiency of the tool is very important. Now, it's very important for giving supportive and constructive feedback whenever you do a training program and you have made a formative assessment. So, you should be very specific and focused. You should not say, oh, this is a very useless assessment you have given me. You have not made the correct response to the case study. He is confused. He doesn't know. He has done the best as far as he is concerned to the best of his ability. You have to be specific. All right. So, you did not address this particular component, then that becomes specific. You can say you have not completely taken 1, 2, 3 points into consideration. The balance, strengths, and areas of improvement should be mentioned. Every assessment should have a feedback to the student. We should use positive. We should never use negative language. So you can say that yes, you have written most of it correctly, and only this part maybe if you will write, it will make your answer perfect. These kind of things can be written and give actionable suggestions that do this and do that. Don't avoid personal criticism and don't overwhelm with too many points. If you write too many things, sometimes the points are more than the content that the poor person has given. That should not happen. Be very crisp, be very specific, and whatever is the most important salient points, you should take care. Now, the purpose of terminal assessment. Summative assessment is terminal assessment. I'll quickly go through this because this you are all aware of. Basically, to record a student's achievement, to assess, sometimes we do terminal assessment for seeing the effectivity of the program and to certify level of knowledge, whether he has failed or he has passed, and also to make decisions about future eligibility. That, all right, you have cleared this particular now caregiver program. As a caregiver, we can ask you to become a master trainer next time. So that is something that can also be used for a terminal assessment. Then we have OSCEs, online or virtual ASCIIs can be used. Vivas can be used for summative assessment. Video recordings, again, live streaming of the skills performed by students. In fact, in a yoga program in IGNO, we did the terminal assessment by live streaming of the yoga asanas to be performed by the students of our program, because there was no way in which we could have tested the students. It was a 6 months program. We didn't know what to do. So we asked the students on Google Meet to switch on their cameras. Simultaneously, the students performed the skills when they were asked. And so we could assess large number of students at the same time. So this is what is called scalability. And we can have case presentations. We can have a logbook. Document cases in workbook also can be done. The challenges of summative assessment, again, availability of resources should be there. We should know how to handle technology if we are going to do it online. There may be connectivity issues at both ends, at the end of the student, at the end of the management. There is a time management, very important, because you have to finish in time. Variety of questions can be covered, and testing the psychomotor skills, and again, plagiarism. Attributes of assessment, you all must be knowing that it should be valid, it should be reliable, it should be acceptable, it should be feasible, and it should have an educational content. So this is my last slide. I went a little fast because there was too much content to cover, but I hope that you have got an overview of what I was trying to tell you. I know assessment is not an easy part to deliver. It will take time for you to understand and go through it, unless you are in the education system and already going through delivering assessments. So monitoring caregiver competency online can be done using online platforms. You can also do through offline platforms, like giving them handouts, taking a feedback of the course content as well as a feedback of the sessions that you have taken. You can track their quiz scores and assignment completions. You can ask them to do certain assignments in front of you, certain skills demonstration in front of you. You mark them. If you find that they are not actually reaching the competency level, then you'd ask them to repeat, ask them to practice again, seeing videos or seeing demonstrations, and then again doing return demonstration till their competency level is achieved. Video submissions is also possible, and regular check-ins via the virtual mentoring sessions is another way of doing this. So just the key takeaway messages is that assignment should be engaging, practical, and supportive, positively supportive. Constructive feedback motivates and improves performance, and online tools allows for continuous competency tracking. So this is what I have to say. If there are any questions, any clarifications required, I'll be happy to clarify.
Thank you. Thank you very much, Professor Ruchika. I think participants would have so many queries or questions. I'll request you to take over the micro teaching section, basically,
Okay, sir.
because we have
We don't have much
limited time, so that's why we cannot accommodate all, but few we can. Okay, so please.
Would you like to suggest whom all to call for this session?
I think it's in a lottery type of situation because all the submissions have been so good. And
yes.
So can we just start with Priya M?
She there?
Because Priya M, is she there? Okay.
Yes, sir, I'm there, sir.
So go ahead, please. It's your platform
Sir, I'm
now.
requesting Dr. Mohan Sundari to share slides, please, if possible. Sorry, I came at present. I didn't have.
I will share. I will share. You
Yeah.
shared my WhatsApp, no?
Yes.
I will just download.
Sorry for that technical glitch.
Can you switch on your video?
Sure, sir.
So Priya, you have done a very excellent job. And while you are presenting, I will probably interrupt in between to also explain to everybody how you have made in consonance with the way it should be for a caregiver. Okay?
Sure, ma'am.
Present.
Is it?
No,
Yeah,
your
yeah.
first one, topic. Yes, this one.
Yeah. So I have chosen topic is caring for a bedridden patient. Especially in that bedridden patient, I have selected for pressure ulcer. So how I am going to give the training for the caregivers to prevention aspect of pressure ulcer, ma'am. Not those who had the pressure ulcer. So my problem statement will be that the effectiveness of training program for caregivers of bedridden geriatric patients on prevention of pressure ulcers. Next slide, ma'am. So my objectives are, so I'm going to assess the baseline.
Can we come back to the problem statement? 1 second, just a second. Yes. So over here, it is very important. You have written it very nicely. So see, we have written situation and problem statement. So what you have actually given is the situation, that is, and the problem statement both, because situation would have been only bedridden, training for bedridden geriatric patient. But you have also given the outcome, that is for the prevention of pressure ulcer. So when we give an outcome of our training program, it becomes a problem statement. Next, please.
Next slide.
Yeah.
Yeah. My objective will be first baseline knowledge and as well as the practices of caregivers I'm going to assess. Then I'm going to implement the training program for the caregivers regarding the pressure ulcer prevention. Then after the training, I'm going to evaluate that post-test kind of knowledge as well as practices I'm going to assess. Then simultaneously, I'm going to assess about that how many incidences of pressure ulcers, the new pressure ulcers has been developed after my training. That is before as well as after that my interventions.
This is an excellent objective, because you are not only testing, what you have taught as a facilitator to the caregiver, but you are also seeing its impact. The last one is very
Yes, ma'am.
important. Very, very good that you have made this, because you are made the impact of your teaching. So
Yes,
you
ma'am.
are so you are not only testing the effectiveness of the trainer learning it, but also your teaching tools. Very good.
Yes, ma'am. Yes, ma'am. Yeah, impact over that geriatric patients also I want to assess. Yes, ma'am. Outcome indicators. The next slide, please, ma'am. Yeah, next the action. What are yeah, the next action, how I am going to implement my training program. First, during the preparative phase, I am going to form a team. So in my team, as a leader, facilitator, as well as overall caregivers are going to be there in the particular area I am going to select. Then afterwards, I am going to develop your training materials. So what are all the ways, like a pre-test tool, as well as that the training material, infographics, that the PowerPoint presentation or video, especially that skin assessment, the different variety of skin assessment, especially for that geriatric patients, they'll be having that dehydrated, dry skin, less fat mass. They are very prone to get that pressure ulcer. So that's why variety of skin assessment in what are all the ways they are going to get the pressure ulcer, especially moisture associated, incontinence associated, as well as that the device associated.
Don't go into the content details. Don't go into content details, because we have other people also to present.
Yeah, sure. Okay, ma'am. Sorry, ma'am. So next, I'm going to gather that the caregivers. So which area I'm going to give that particular area that caregivers I'm going to select. Then I'm going to give that pre-test as well as post-test of knowledge as well as practice, and I'm going to implement my training packages as well as the evaluation of training package in the form of knowledge as well as practice. At the same time, that incidence rate of pressure ulcer also. Next slide, ma'am. So this is that the resources that the minimal, actually no need to go for that financial constraints. So it is India is a developing country. So with that, whatever the available resources are there, with the help of that, how we can able to go for this implementation of this program. Whatever that available material it is there in their home, with that we can make the understandable to the caregivers to how to prevent that pressure ulcer. Next one. So here we can expect that already I have done so many in that hospital side, we have faced so many issues. If suppose simply nursing officer will be teaching also, we'll be facing that lot of issues. If suppose as a caregiver, the informal caregivers, we are going to means we'll be facing that lot of issues like a low literacy as well as lack of medical knowledge. So for that, we can give that simple language, visual aid, demonstration, role plays. With the help of that one, we can teach to that caregivers. Then they are not able to maintain the compliance. Whatever we can teach, it is not possible to implement it. So they will be having that the poor compliance. So for that, we can have the checklist, logbook. So what is that emphasization we can give? What is the importance of doing all those things? As well as that caregivers, they'll be having the burnout. Always for bedridden patient to take care means from top to bottom, they have to do everything. So they'll be having that lack of motivation as well as burnout. So we have to assess their psychosocial impact as well as a lot of counseling sessions we have to explain. Next slide, no? Then apart from that, they'll be having the patient-related challenges also. So it depends. If suppose orthopedic patient will be having a different problem as well as that stroke patients will be having. So we have to depends upon the condition of the patient. We have to identify it. And then those who are non-cooperated patients also will be there. Usually that old age people, they'll be having the pain, those things and all. So it will be difficult to, for simple turning the patient also. So we have to explain everything and we have to get the cooperation and then we have to do those things. Next slide, ma'am. So next, that expected outcome will be the knowledge as well as the improvement, practices improvement will be there. At the same time, reduction of incidence rate of pressure ulcer, and then quality of life. If suppose we'll be preventing the pressure ulcer, that quality of life also will be increased, and the reduced healthcare burden also to that to decreasing that pressure ulcer rate. Next slide, ma'am. So how we are going to evaluate that process indicator as well as that outcome indicator I have kept. So the process indicators will be observation checklist, attendance register for the training session, as well as caregiver feedback we can take. So we can identify that barriers as well as the facilitators what we have given the training, we can take it out, as well as the frequent monitoring of baseline before as well as the after. And we'll have the follow-up also, 2 weeks once, 4 weeks once, and 8 weeks once, how the track we can able to monitor, whether we can able to achieve the goal or not, we can able to identify it. Next slide, no? Yes. So whatever the template, due to lack of short of time, I have rushed up.
So anybody has any comments? Any of the participants would like to say something? Then I will request Dr. Mathur to give his inputs.
I think the presentation has been excellent, and the issue brought out has been very relevant. Pressure ulcers are a major issue, and for bedridden patients, for immobilized patients. And she has correctly highlighted the various constraints which could come across for implementing. I think I expect more and more participants to come out and react to these presentations. We have got a few more presentations in line. So I'll just now request Madam Purvita Vijay Lakshmi, if she could join us and give her presentation. Yeah, ma'am.
Actually,
Yeah.
I don't prepare my slide
No,
presentation, just in the word.
No need for
Maybe.
slides.
Hello, Mohana ji, please stop sharing your screen.
So you have not prepared, there is no problem. We can take it from the Google form itself. You can present from the Google form. I will share the Google form. No issues. One second.
Okay. Can you see my word? My screen share? Can you see?
Yeah, we can see your screen, please. Yeah.
Okay.
Yeah.
So, okay. Good afternoon. Thank you for
You
the
can
opportunity.
enlarge it. You can enlarge it a little bit from below.
Oh, okay.
Increase the size so that everybody.
Okay. Is it okay?
Little bit more. Yeah.
Okay.
Yeah. No, thoda sa
No,
chota. Reduce little bit. Reduce.
Reduce.
Yeah, that's fine. That's fine.
Okay.
That's fine.
Yes. So maybe it's apart from the previous presenter, it's a little bit shorter than hers. That quite very good. My topic is improving record keeping for care at home. So the problem I identify, how can family or pet caregivers to be trained to maintain clear and consistent records. So my objectives are to identify caregivers' prior knowledge on patient records, including the importance of the patient records, the objectives, why they should take patient records, and also the aspects that need to be recorded. And second is to explain how to make records easy and accessible. Third, to ensure accuracy in recording the patient condition, and also to improve communication among caregivers, family members, and physicians through patient records. So the step of actions, including the healthcare worker on the first or second when necessary home visit, interview to elaborate the caregiver's prior knowledge and examine the records that have been made by the caregiver. So we can examine what we have done by the caregivers and giving constructive feedback, what is already right and what have to be improved. Explain the importance and objective of patient record as well as the things that should be recorded according to the patient case. Introducing care logs that's suitable for the patient case. Train the caregivers, expand the use of book or Google Sheet or digital apps to record the patient condition. So resources required would be logbooks for traditional books, and also we can use smartphones and also laptop or PC. The challenges expected and solution possible, including caregivers' level of education, because maybe some caregivers still illiterate or there is gaps in ICT use. internet and communication technology use, and also about the digital DVD. In order to solve those problems, we have to train step by step with example, or to demonstrate how to fill in the care logs, review and retrain when necessary, and also encouragement with positive support and constructive feedback. Expected outcomes would be described fewer error in recording the patient condition, better patient care and continuity of care, early identification of emergency signs. For example, when the patient has diabetes mellitus, signs when they check the blood glucose, when it is low or whether it is high, it can be a signs of emergency. And also improve communication with healthcare workers, because when during the home visit, the healthcare workers can examine or check the logbooks, and then they can make a conclusion whether the blood glucose, for example, or blood pressure of the patient is in control in every route, basically in a controlled manner. And also for the evaluation or monitoring plan, periodic internal audits, it can be done among caregivers or by family member. If the caregiver is a paid caregiver, so family member can supervise the caregiver through the periodic internal audits of the records. And also caregiver feedback, we can ask the caregiver the pitfalls or the difficulty in using or in filling the log care, and also review by the medical staff during consultation. Maybe that's all that I can share with all of you. Sorry for
No, it has been so good, so good.
It's an excellent thing. Only my one observation was there on this, that the scalability option is not much there, because you you as a facilitator have to go to the house of the caregiver and then check. So maybe you can, other components are very, very good. All components that you have elaborated. Only thing is this component, maybe you can think of alternative, and where they can all come, in their classroom session, and over there you can maybe they could get small videos of how they are taking care of this particular record and all that, and that they can show in a presentation. Maybe that is something which you can think of. Anybody has any other
Thank
comments? Yeah, thank you so much.
I think now since we are we are short of time, but I'll request Dr. Devnarayan to briefly give his presentation. So time we'll reduce it to less than 5 minutes. Okay.
Okay, sir. No issues. Thank you, sir. Whether I am audible?
Yes.
Okay. It's not working from. Yeah. Just wait for 2 minutes.
Yes, it's visible now.
It's visible now. Yes. The plan of action on fall prevention among older adults in tribal communities under conduct MP. Situation is just what happened to this? Okay, situation is falls among older adults are a major public health issue, especially in tribal areas like Amarkantak, Madhya Pradesh. Poor housing conditions, limited mobility aids, and inadequate lighting increase the risk. Lack of access to healthcare and awareness worsens the problems. And without prevention, falls can cause serious injury or death, impacting entire families and community. So if the fall situation and the impact of the problems are together resolved effectively, there may be it leads to reduced falls, improved elder health, safer homes, better healthcare access, increased awareness, lower cost, and a stronger community support system. So objective. Objectives of the this situation is increase awareness of fall risk and prevention in tribal communities. Second one, identify and support high risk older adults through regular screening. Third one, reduce environmental hazards in and around homes. Fourth one, improve physical strength and balance among older adults. And the fifth one, ensure proper medication, vision and hearing management. Next one, involve community and families in long-term fall preventions. The last one, monitor and evaluate outcomes for continuous improvement. Then steps for this activity: conduct awareness workshop in local dialects using folk media, talks, street plays, songs.
Dr. Dev,
Sir.
It's a real comprehensive plan which you are going through. Okay. Can you highlight the issues related with the caregivers? Okay.
Caregivers.
Yeah, because we are looking at the projects which would be highlighting the care. How would you involve caregivers in this particular task?
The third point, you can read the third point.
You can read the third point.
I will. Yeah. I'll here train Ashas to conduct annual fall risk screening. The timed up and go test is a simple and widely used clinical test to assess a person's mobility, balance, and responsibility in older adults. So, based on this, they will assess, and it will be a one-day training program session, and they refer the client and even prevent for the such case scenario, such cases where the falls is possible. They will try to reduce the falls. Here I can see, identify high-risk elders and refer to PHC, CSC, conduct home visits and improve home settings. Then start a weekly group exercise like yoga, walking, and organize medical.
Dr. Dev, what you have done is actually you have mixed the training program plan of a caregiver with a training plan of a master trainer. So like Dr. Mathur also said, only the third point is what you need to project. The rest are all activities that a caregiver will. Isn't it? He will do those things. So you as a facilitator now, you as a master trainer, what will your resources be required to train the ANMs? That is what you should just talk about now. Yeah.
Okay. So here human resources need. I require human resources also. For example, I will first engage select the Asha and ANM, and then we'll teach the
this particular
volunteers.
Plan is in a presentation is primarily of a project which they are planning to do for fall prevention in community. Yeah, correct. Fine. I think that has been so good. That has been
very
so
nicely
good.
presented. Very nicely.
Very nicely presented. Yeah.
So human resources include Asha and ANM workers.
I think that all those details are there. Thank you. Okay.
Then, resources other than resources, challenges are expected is solutions are there. Cultural resistance or low awareness. Use local dialects, folk tradition, and tribal leader for communication. Limited health care access is a challenge. Use mobile health vans, Asha outreach, and NGO collaborations. Shortage of trained personnel are there. Train local youth and leverage volunteers or interns. These are the challenges and possible solutions. And expected outcomes: increase community awareness of fall risk and prevention, early identification and support for high risk older adults, safer homes and public environment for elderly residents, improve strength, balance, and physical confidence in older adults, greater community engagement and social mobility, reduce fall-related injuries and hospitalization, and greater community participation in the elder care and health. Thank you.
Thank you. Thank you very much. I think it has been a comprehensive plan. We wish all the success for this. I'll request Professor Vishnupriya Bishwas, to have the presentation, please. Can you stop sharing it? Professor Vishnupriya? Yeah, ma'am.
You'll have to unmute yourself, madam. You are mute. Yeah.
Actually, I have just filled up the form, the Google form what you have given, but I am not ready for presentation. I didn't know that I have to present. I thought maybe presentation or this thing. I thought in that way.
Okay.
I can project what I have written. It is
I think then I'll request Dr. Sophia to
Okay.
give her presentation, please.
I also make it in the Google form. Yeah, no problem. So, yeah, I don't have any presentation. No need. Your content is more than enough. Please share the Google form.
Yes.
Share the Google form.
Please share your Google form.
Okay, I will have to look for that first. I don't know how to find it. Can you help me to share that? I will share it for you. I will share your Google form. Okay, thank you. Yeah, no problem. Is it visible? Yeah. Okay, you can start from here now. Yeah, okay. This is my topic is fall prevention for older adults in the community. The situation or problem that I often find, yeah, the last one is my own mom. She fell down last week and then got femur hip fracture. So fall often happens to elderly people, and the main triggers are frailty, osteoporosis, and sarcopenia. This leads to hip, femur, arm fractures, which will cause disability and loss of independence. Also to add family burden and healthcare costs. And my objective for the caregiver is for she or she to able to know the fall risk factors for the elderly, and then able to assess the activity daily living and the ability of the elderly in moving, able to provide a safe environment for the elderly, able to know what kind of footwear is proper and what kind of assistive device is required for walking, able to assist safe walking, and able to help the elderly do exercises, including the range of motion exercise in daily routine. And my steps of action: first, to educate the caregivers about the fall risk factors, and then do home assessment and giving advice for a safe environment, do physical and cognitive examinations, check on comorbidities and review polypharmacy, teach how to do exercise such as aerobic resistance, balance training, and range of motion. And then teach how to encourage the elderly use assistive aids such as eyeglasses, hearing aid, walker, etc. if needed. And the resources required, I'll use the PPT slides to inform about all fall risk factors, and then do home assessment together and show them which obstacles to remove and what tools must be provided to keep the elderly safe, such as the handrail, and then use video to show about the exercises proper for the elderly. And the challenges expected is that fall can happen anytime and anywhere, even at home and under unexpected conditions. And the person with fall risk may not want to follow the advice, such as using walker, hearing aid. This is the problem of one of my patients, and then she has the severe dementia. And then the informal caregiver cannot supervise the patient all the time. And whereas to have a paid caregiver is not affordable, we have to pay for that, right? And then the solutions possible To make
I would
home
like to
environment
stop you
actually
here. I would like to stop you here because you started very well. You see, over here, objectives, you have given the objectives for the caregiver to be able to know the fall risk, isn't it? To be able to assess the daily activities. But when you come here, see the challenges, it happens with all of us, don't worry. Because what is happening is, if you try to reflect, these are the challenges of the elderly that you are telling. These are not the challenges of your training that you're telling. We wanted you to tell what challenges you will find when you will be training a caregiver. Is it okay? Are you understanding? So your challenge should have been probably that, language could have been a barrier. When you are talking in one language, maybe your caregiver don't really understand. Okay, the level of experience or comprehension may not be that because their previous experience is not that. Am I
okay?
Are you able to understand what I'm saying?
Yeah.
Because see, you are saying fall can happen anywhere, anytime. This is not the challenge of your training program. This is a challenge that the caregiver may experience with the elderly. We are talking about the challenge that our training may have when we are trying to train. So we may not find adequate resources. The caregiver may not find adequate time to come for training. These are probably the challenges that we may experience when we do the training program. Is it okay?
Yeah.
Hello, madam.
Okay.
Yes,
I understand.
Can I this Google form?
I'm not able to hear you, madam. Yeah.
Okay. I just unmute. I wanted.
Yeah, I understand my problem with this
Yes. It happens with
presentation.
all
Okay.
of us because it is difficult for us. We are all caregivers also. It is difficult for us to, come out of the comfort zone of a caregiver and become a trainer. So you are a trainer at present. So I wanted to tell everybody because many people have made this mistake. You started off very well. Many people have not started off also like this. They have put the objectives of a caregiver and not the objectives of a trainer. That is what is important. So all of you, please take care of this because if you now go back and look at your plan of action, you will see where all you may have made this kind of a slip. So Sophia, thank you so much. Thank you.
Okay, you're welcome. Thank you.
Thank you very much for our participants' presentation. I wish we had more and more participants presenting their teaching sessions, but for the time, because we have to restrict it here. We will be all connected throughout, and today I have privilege in welcoming Dr. Alok Mathur, who is Additional Deputy Director General, Ministry of Health and Family Welfare, Government of India, New Delhi, who has joined us for the program. We have Professor Arunanshu Talukdar with us, who heads the Department of Geriatrics and the Regional Geriatrics Center at Kolkata. Along with this, Professor Lakshmikant Goyal is also there from SMS Medical College. He heads the Department of Geriatrics at SMS Medical College, a prestigious college at Jaipur. We will have few more guests joining us for the next valedictory session, because we at this particular session is going to be there for all the participants to give their feedback, observations, and our guests to provide us guidance. So first, I welcome you all, Professor Talukdar. Doctor, yeah, please.
Good afternoon, everybody. Thank you, sir, for giving me the opportunity to interact in this forum. So, though I was not a participant all the 3 days, Ruchika ma'am, hello ma'am. But yesterday I also just keenly noticed what are the topic you are discussing, and today also, because almost 9 participants are from my institute and my NGOs institute. So their feedback is it's a wonderful training program. Already they shared with me that there is a nice program is going on, and they are very much will be benefited for these things, and it will help me to strengthen my department as well as also when we go for the social service or the geriatric caregiver training. So I think we will have the highly resourceful trainer at this moment with this training to in West Bengal. Thank you all.
Thank you, Professor Talukdar, for supporting and the program, and presence of all the participants from your end have been a great help for us, and they have been quite interactive for giving their experience also during discussions. So I think we have to hear from the participants also now. Please come forward and tell. For this, I think no preparation is needed, no presentations, but please come out and give your opinion. How would you like the program to be modified, improvised, or what else need to be done? Because there is one more thing, that such type of program cannot end in 2 days. Probably it's in a beginning. And from this time onwards, we stay connected for all the future learning processes or so, isn't it? So I think let us hear from all the participants. Professor Vishwas, please.
Dr. Mathur, actually, what I wanted to know that your presentation were excellent, and actually, it is the basic thing. Since we are trained in the nursing courses, BSc and MSc nursing, some of the percentages might be GNM also, but we have got vivid knowledge about all those things. But the simplest way of presentation, really, I appreciate. But one more thing I wanted to say that this sort of training, a skill is required. So unless and until there are hands-on sessions, it is really difficult to have this skill, means become a trainer. So I think this at the local level, if you can arrange, maybe it is not a centrally, but locally, such as about the West Bengal, we can have this training on hands-on. So it might be very helpful. I feel so.
Your observation is absolutely correct. Caregiving has to be learned on hands-on only. Our endeavor has been to simplify the knowledge which you have in the nursing or medical segment, which is quite high-end. But we wanted to simplify it into such a fashion that a common man, a family caregiver, need not be educated also. So a common man can learn about it. And we also tried to make it focused for what they need to learn. The knowledge is quite vast, but we wanted to narrow it down for the areas which are important for the caregiver. So that's why it has been the idea of having this training was also just to give the narrowed part of your knowledge which you need to impart further on to the caregivers. And we expect the hands-on part to be developed by each trainer at his place according to his local conditions, and because that training is there with all the participants, because they are all master trainers. So the hands-on training part they will be imparting. We just wanted to show that what they need to show or what they need to tell. That was the effort which we are trying to do.
So shall I have to prepare our own or develop our own center for this thing, and with the help of might be Dr. Talukdar is there, maybe with the help of them we can set up our own unit so that
I think yes, this is a doable thing. With Professor Talukdar being there and with your expertise and your experience, this is absolutely doable thing and a desired thing, I would say. It's a desired thing which could be done anywhere. I think it's such a simple task which could be established anywhere with all the knowledge which you already have, basically.
Okay, sir. Thank you. Actually, I didn't know that you can share my presentation, my Google form. Otherwise, I also would have presented. I'm feeling bad about it. Anyway, there is no time also.
आपका अच्छा था मैडम, आपका बहुत अच्छा था. It was very good.
Your presentation was so good, and that's why we wanted
I didn't know. I
No
didn't know
problem.
that you can project mine. Okay. Thank you. Thank you, sir. Thank you.
I think Dr. Mona Sundari and their team, particularly Professor Dr. Lata, the Principal College of Nursing, AIMS Bibinagar, and Dr. S.K. Mona Sundari and her colleagues, Manulata and Nikita, have been instrumental in creating the whole set component of geriatric care, core care component, basically. Welcome, ma'am. Okay.
There Zoom platform app hello.
Yeah, hello. Yeah, ma'am, we were just talking about you only. Unmute, Dr. Mona. Please unmute.
Thank you so much, sir. Sorry, I joined a bit late.
Yeah, I know you had a lot of administrative responsibilities, and it has been nice that you were there with us yesterday also and today also. Your presence means a lot to us, and your team
My
has
pleasure, sir.
your team has done a great job, and I think this is our beginning, which we need to continue forward. The Professor Dr. Lata T is Principal College of Nursing at AIMS Bibinagar and has been involved in the community education and work for so many years. So we carry forward from this. Over to you, ma'am, for your comments.
Yeah, it was really very nice interacting with everyone, and I'm sure this hard work of Professor Mathur sir will have a fruitful result, and our patients indirectly we are helping the patients to be benefiting the little work whatever we do. This is like it is not everybody is taking a course and then you get a job or something like that. It is out of interest we are doing it. So when we do it out of interest voluntarily, I feel the result will be better than what we do it when somebody is compelling you to do it. So I really appreciate all the participants taking up this course and being with us for these 2 days, and your enthusiasm and interest. I could really make out that so many of you are so much interested, and this is going to be resulted in the better patient management. And as the organizer said, if you need any help at any time, we are available. Definitely, we would look forward for your better patient care through the caregivers. Ultimately, we want to have a better quality care for the patients, for their families, and ultimately to the entire community. So, with this, we will start this as a program. As I said, this is a beginning, and we have a long way to go. Let all of us wish that we will have a successful journey. Thank you very much, sir. And thanks to all the organizers and all the participants.
Thank you. Thank you very much for encouraging everybody. And I think this is a journey which will be successful only with combined effort itself. And in our day-to-day practice, all these years, I've seen that my patient's outcome is directly proportional to the quality of caregiver they have. So the caregiver ultimately decides the health outcome also in most of the persons. And along with this, this component of healthcare system is under recognized. So we are trying at the Caregivers Asha Society to have advocacy to include caregivers and the family caregivers as a part of healthcare system also. So that is, I think we have to hear from the participants. We'll really love if, and I'm grateful for all our colleagues from Nepal and Indonesia who joined us for this particular program, and that has been motivating us to do much more than. I have pleasure in welcoming Dr. Harish Agarwal also, who is in charge Regional Geriatric Center at SN Medical College. Dr. Harish, can you switch on your camera, please?
Good afternoon, everybody. And sorry, I joined lately, but I can see the program a little bit, the few of the presentations also in between. And this is the ultimate program which we can thought of. And thanks to Dr. Mathur sir, who has implanted the seed for this caregiving for everybody to think about and water it to reach it to up to a big growth. Thank you.
Thank you, Dr. Harish. We have got an important task about which I think our Professor Patniji would be talking about, because all this hard work of yours for 2 days, you have given your precious time to us, which needs to be recognized and which needs to be carried forward, for your growth also and for our growth. So Professor Patniji will be telling us about what are the tasks now for all the participants and how are we going to go beyond it now, about the certain assessments.
Thank you, sir. Just a minute.
I think Professor Chetri is also there with us. I think, after Patniji.
Please, we would like to listen hear from Professor Chetri first.
Okay.
Yes.
I'll now thank him first.
Yes, sir.
For having initiated us and motivated us to start with this program. And it started with 2 participants, basically. And I'd like to hear from Professor Chetri that we to learn about how to go beyond it also. Please. Professor
Thank
Chetri
you.
is president of Nepalese Society of Gerontology and Geriatrics. He is professor of geriatrics at Beijing University, Peking, and with so many other assignments with him. Over to you, sir.
Thank you, Mathur sir. It's been a great 2 days. I've been listening a lot, looking a lot, and learning a lot as well. So it's beyond just medicine for clinicians like us. So it's caregiving is more, being every day together with older people. So it was a lot of learning, and I like the modules, what's being done by Dr. Mathur and all of you. I think at Kerasa, that's very innovative, and it's very inspiring. So congratulations, and I wish you all the best for this program, for the program. These 2 days, all of us, we learned what to focus on while we are as a trainer, how we would want to train the caregivers. We are not talking about nurses or a higher level of thing, but like how to share the whole life of older people when they are suffering or when they need help. So that's really means something. Just now, Dr. Mathur was saying that if you have a good caregiver, then you age well. If you don't have someone taking care of you, then it's worse. We see it every day in clinical practice. We see someone who is so old and has cognitive problem that he does not know what medicine he's been taking, comes up with a huge bag of medicine, and he doesn't know what he's taking. Someone, he has Parkinson, but seems that he has already developed dementia at the same time, but there is no one to help the patient manage his medicine, or he doesn't know what he's in fact doing. So that's a real big problem. So if we have good caregivers, like just now we learned how to make report, noting the everyday what's being done and how the medication are being managed. So that means a lot for the well-being of older people. So thank you for teaching us those things, Dr. Mathur sir. Of course, we want to see these kind of things going in Nepal, Indonesia, India, everywhere in Africa or someone like that. We can also push this through the International Geriatric Society, where I'm one of the council member. And of course, we have the working group with the IAGG with Jean-Pierre Michel. So he does the training program for geriatrics. So I think this training program can be mixed together. Of course, and I'm also affiliated with the World Falls Prevention Society. So we can, this is a very good initiative. So with some modification, I think we need to make such programs available to the whole world, not only Asian region, but because it's the same thing. Only we need to change a little bit of more context. That thing. So I'm very thankful to Dr. Mathur and the whole team. You've been working so hard, and congratulations as well. Thank you, sir.
Thank you. Thank you very much for all the kind words. I'd like to share one important thing, that Care Asha app, which we have, is probably, it addresses the global issues. We got it translated in, it is available right now in English, Hindi, Tamil, and Bangla. Thanks to Professor Talukdar, that we could get the Bangla translation. His staff, Upasna, and other members, they have been working regularly with us for developing the Bangla version of that. This particular app is a generic thing. It is applicable in any language because it talks about the basic things. There is nothing beyond that. So we feel that adopting it in any other place, may it be in Nepal or I just requested our colleagues in Indonesia also if it could be translated in Bahasa, or even African countries also, it is going to be useful. I'm happy to tell that today this app has been downloaded in 37 countries, many of African countries also. So I think this, and secondly, caregiving is a basic thing for human life. So it is a generic thing which could be expanded beyond the borders and boundaries, basically. Thank you very much, Professor Chetri, for all the kind words and support. And we are keen that if such movement is carried forward wherever it is possible, it is going to be great for us. Thank you. Thank you very much. Professor Patni for
yes,
sir. Please.
Last minute, last things. Pre-test, pre-quiz we have already attempted. The same questionnaire is there in the form of post-quiz, so that we can compare the knowledge gain from your side, and from our side also we can evaluate our 2 days program, how we could successfully done so far. Then there is a final quiz at the end of the program, which is not mandatory for us to be to be qualified for the certification. But yes, pre and post quiz are necessary. And then there is a feedback form which we would like everyone to be enthusiastically filling so that we can get the actual feedback. See, as Professor Mathur has mentioned earlier, and Professor Chetri is also here, I would like to mention here one thing, that when sir and our team was communicating that this kind of program we are planning, and there is one request or one offer or something from Professor Chetri, who is in Nepal and presently in Beijing, working in Beijing, and he likes to have. I immediately said that we thought about it to be a local program, and in the first hit it is going at the international level. So we may not be able to have the kind of level of understanding that what is needed at the international level, but the enthusiasm of the people, all of the participants, has made it successful. There may be certain issues, certain technical glitches, for which I take my personal responsibility, and we will be definitely improving on all of them. Certificates are ready. Time is again 2 past 15 here. Food is also waiting for us. So please fill the forms and the test, attempt the test, and then we will be able to share the successful certificates on your emails only. Not we'll be not distributing them on the WhatsApp group.
I think one has to ensure a proper spelling of the names.
We will be
because
definitely.
they will just pick from there to the
Yes, sir.
to the certificate.
And two more things I would like to mention here. Please see the name of the affiliated organization institute and check if the small caps are also proper. We'll not be able to check each and every. For example, I mention here All India Institute of Medical Sciences. All A is capital, India is capital, but Medical Sciences M capital, S remains small. That again is going to be a problem or issue. It doesn't look nice. That's it. From the point of view of facts, it is okay, but the presentation doesn't look nice. So please do check these things and fill the forms.
Yeah, we also mentioned about city and countries also.
City and
I think
countries also mentioned in
the
form.
chat box already it has been shared. So this is very important because the certificates will be mailing them according to the mail addresses provided,
which are mentioned in the registration form, sir.
Yeah. So,
and this is our first training program, ToT, training of trainers. We'll definitely be organizing such programs in the coming days. I'm not saying coming months, I'm saying in coming days, because there are lot many queries, and because of the technical restrictions we were not able to accommodate all of them here in this particular 2 days program. Please feel free to connect with us. Please feel free to spread the word in your colleagues, and please do remain connected with us. Thank you so much.
Professor Ruchikaji's final word before we close.
Sorry, sir, in between. I, on behalf of the Caregivers Asha Society, would like to personally thank Dr. Chetri, Dr. Ruchika ma'am, and Dr. Mohan Sundari. The ignition was from Dr. Jagdish. अकेला ही चला था जानी में मंजिल, मगर लोग जुड़ते गए, कारवां बनता गया. This is the one thing. We started with 2 and we ended with 100 plus. Ruchika ma'am's
206 registrations, and we had to deny half of them.
That is what I'm saying.
Because we were not prepared for that. So
अब वो जगदीश सर ने आग लगाई है तो वो आग बढ़ेगी आगे और it will go beyond
Thank you, Professor. So it's a pleasure that it happened. So
and
I'm very happy.
Ruchika ma'am's detailing is remarkable. Each and
Indeed.
individual, her experience is always something by which I always learn. And Mohan Sundari's enthusiasm and Dr. Lata with her, when we were thinking about who will be the speakers, and in a single click, all the problem was resolved by Dr. Lata. And her enthusiasm also was very much appreciated. Thank you so much. And all those whom I don't know in person, but they have helped here. And behind the scene, Dr. Sorry, not
I
she's
think
not doctor yet.
I'll request
Khushbu?
Khushbu to switch on her camera.
Yes,
And
that is what I'm
I'd
saying.
like to introduce the person behind the
The
scene
bot,
as the
as per
and
Ruchika ma'am, the bot behind this.
this the whole
So I'm
program.
not in a good condition. I'm having cold, but
Okay,
I'm
okay,
switching it on.
okay, okay. In
Hi,
spite of having fever for last 2 days, she has been working till late in the night for all this. So whatever you see is all because of her, basically.
thank you.
Thank you, Kushbu,
All
for
the
all the
participants,
help.
please check the details and please
Revert
fill the
back on
form
the
and
please.
the post and pre test also if they have not done yet. Thank you.
Thank Professor Ruchika ji, thank you very much.
Thank you, sir. Thank you. It has been a
And
pleasure to be connected, and it is always a pleasure to be connected with anything which Dr. Mathur does. It is a totally
my
learning experience. It is a learning
no,
experience while teaching. I always tell everybody that I am the first student because I like to learn from everything. In the morning, sir, you gave me task at 10 o'clock to make the presentation for the evaluation assessment. It was a
I
real
know you
challenge
can
for
do
me.
that.
But I am really very touched by Dr. Lata and her team. The enthusiasm, the kind of, passion that you have shown is really remarkable, remarkable. And this is the type of passion that is probably will be transmitted to all the participants. And this is what is really required for a subject like this. And thank you, Dr. Jagdish, for making us all connected. And Dr. Talukdar is always enthusiastic, very important subject. It is close to his heart. So that is why thanks to him and his team who have joined so many people from this thing, Center for CIN have joined. And Dr. Patni, thank you so much for your appreciations. And that is what makes me go further and further to, excel myself more than what I am. Dr. Mathur's quality is that he brings out the best in people. I do not even know that I can do this, but he makes me do it. So I'm thankful to you and thank you so much, sir.
Thank you.
Thank you, everybody, for being with us all these days. I wanted one of the participants to speak out. I think probably they are busy with the forms which they have to fill. Okay. I think carrying forward this particular mission of caregiving is important and probably the important task of all the medical persons also. That's what I feel. And I'm happy that Professor Talukdar, uh, Professor Chitri, they all realize the importance of this particular task. And we feel that finding some innovative ways of carrying forward this message would be important. And we are open to learn about it from everyone. Okay. And there is a standing invitation to Jodhpur, please. It's our privilege. If you visit Jodhpur, we will be more than happy to host you this year.
Let me add one more word, Dr. Mathur. So Dr. Mathur will be joining us in December in Nepal for the Asia Pacific geriatric network meeting. So if any of you are interested, you are welcome to join. It's a one-day program on December 6th this year. So we have people coming all around from the world just to share geriatrics things. So if you are interested, please contact me. You're welcome to join and we can meet up again. Stay connected. I would say like stay connected. Thank you.
If permitted, I will share the flyer
Sure.
with the group, basically.
Sure, why not?
Because
Sure.
because in our group right now, even in our WhatsApp group, we have got more than 150 participants. So I'll share the flyer also with them.
Sure, why not? Sure, Dr. Mathur. Thank you.
Yeah. Can we request everybody to switch on their cameras so that we can have a photograph together? Khushbu would be doing the task?
Yes, sir, I'm doing it.
Okay.
A great
So,
idea.
You'll have to move to all the three because mine can see only 25 at a time.
Yes, sir, I'm doing it. Not everyone's on the camera.
I think
Okay, everyone, thank you. We've checked it.
okay. Thank you, Khushbu. Thank you very much. So, thank you everybody for being with us all these 2 days, giving us the time for this particular thing, which is very, very close to us, very close to us. And we look forward for continued association, continued connection, where we'll continue to work for this particular cause. Welcome. Okay.
Thank you, everybody.
Thank you. Thank you, everybody. Thank you.
Thank you,
Thank you,
everybody.
sir.
Thank
Thank you all.
Thank you.
Thank you, Ruchika ma'am.
Thank you.
Thank you, sir.
Thank you, everybody.
Thank you, Professor Lata. Thank you very much. Okay. We will keep the meeting on till everybody has finished the task of the filling those forms or copying those forms. Link. I hope everybody has taken the link for the presentations. No?
Yes, and I also share to WhatsApp group links.
Okay.
Harish sir was there.
Feedback form is already there on in the chat box. There is somebody has asked for feedback form. once you have finished with your feedback and the pre-posted quiz, you may leave the meeting also, no problem. And may I close the meeting, end the meeting, Kushbu? Or still, probably participants are still doing that. Okay.
Yes, sir.
Uh,
I
okay.
think everyone did it. And
Everyone did it. Okay.
if they wanted to, they can do it later too.
Yeah, they must have got the links with them, no?
Yes, they all,
And they
everyone
can
has
do
the
it,
link.
yeah, by evening they can submit it.
The links
Yes.
are there in the WhatsApp group, sir, so they may leave here, no issues in that.
Okay. So thank you very much for everybody for being with us. Both the days it has been great connecting. Thank you. So we say goodbye to everyone.
Yes, goodbye to everyone. So you can end the meeting.
Okay.